Get this started. Virginia, are you there? Do you have the script for folks to sign on, or can you remember it verbatim?
Well, actually, it's at the top of the agenda. It says that we are following A, B, whatever the number is. But in order to get on, people who wish to make comment today, there's information on the front of the agenda and on the screen if you're watching this at home, that'll tell you how you can call in and take part of the meeting. Does that work? Okay. Is that close?
Sure. Oh, there it is. I see it now. It's on the page before. All right. Well, then we're ready to rock and roll. All right. Let's start with the roll call, shall we? Or should I just read into the record? I'll just start with it. In accordance with AB 361, the Humboldt County Board of Supervisors meetings will be held virtually until further notice. And that's what we're doing. To submit public comment to the board, this is by email. You can email co@co.humboldt.ca.us and provide your name and the agenda item that you wish to comment on. So for Zoom, when the Board of Supervisors announces the agenda item we wish to comment in, call the conference line and turn on your TV or TV live stream. Please call 720-707-2699 and enter a meeting ID of 820-7107-9365 and press the *9 button on your phone. And we'll remind you about that when we get to that point with regards to pressing your *9. And this will raise your hand. And you'll be able to continue hearing this. Now, I want to remind everybody too that if you're watching this on TV, there's a delay. So we'll account for that, but just please be patient and understand that there's a delay with that. When it's time for public comment on an item you wish to speak on, the clerk of the board will unmute your phone. You'll hear a prompt that will indicate your phone is unmuted, and staff will then ask you to state your name and begin your comment. And you have 3 minutes and possibly 2, depending on how many people we have signed up today. We'll determine that as we move forward. And you may access the live stream meeting by following the link at humboldt.legistar.com. So with that, I think we can start the meeting, and we'll start with a roll call.
Okay, thank you. Supervisor Bohn?
Aye.
Supervisor Bushnell? Supervisor Bushnell? I know she's on. Okay. Supervisor Bass?
Yes.
Supervisor Madrone?
Yes, here.
Supervisor Wilson?
Present.
Thank you.
All right. So the next thing we're going to do is do the flag salute. And I think we have a flag somewhere out there in our digital land out there. And we'll just get that going. All right. Do this however you do it. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation for the underdog, indivisible, with liberty and justice for all. All right, moving on. We're going to do public comment for non-agendized items. This is where you can comment on things that are not on the agenda, but do have to be related to this. So it's a little bit tricky. You can't go too far afield. But it's basically things not on the agenda. I'm going to bring up the participant list here on my thing here, and let's see if we have any hands up for that. I'm going to wait a minute to see if hands come up for that. I have 3 attendees with hands up. We have 4 and 5, 6. All right. And I'm going to close this off with regards to if you want to speak to this, then I need you to put your hand up now or forever hold your peace here. I'm going to roll through these because I can't. 7454 0151 2223 3053. Remember, this is things not on the agenda, but agenda adjacent, I guess you'd say. 7, 2. All right, so we have a pretty good lineup of folks wanting to speak on things not on the agenda. I know we have looks like we're gonna have plenty of public comment today on things on the agenda. So what I'm gonna do is I'm gonna limit public comment for things not on the agenda to 2 minutes today, so that we can get to what we're trying to get to. And if you feel like you haven't been, that wasn't enough time for you, you're welcome to send us an email, make phone calls, all those other things. But I think 2 minutes should be enough to express those things that are not on the agenda today. So with that, we're going to move forward, and we'll start with public commenter 7454. Please jump in and state your name, and if you can have your public comment for things not on the agenda.
I have a point of order. I don't have a clue what's going on with this. This is not normal procedure. So we're supposed to speak of something related to the agenda, but not on the agenda. That makes no sense whatsoever. I need some clarity.
Sure. I think it's a reasonable question. So let's hold on there. Public commenter 7454, and ask our county council to maybe clarify what we're talking about here.
Yes, thank you, Chair. As this item is agendized, it's public comments on anything within the board's jurisdiction.
Okay, great. Then I take that back. I was misinformed from from a meeting before. I thought in special meetings that the public comment in general is for things that are on the agenda, but maybe related. But maybe, I guess I'm wrong, and so we'll move forward. You want to clarify, Jefferson?
Chair, if I may, it may be agendized that way, but this agenda has time for public comment on non-agenda items, so you should take that.
Excellent. Well, that's what we'll do. Thank you, and thank you, public commenters 7454, for helping us get that straightened out. And so with that, you can comment on anything you want. Go for it. But 2 minutes on this, because I really want us to get into what we're getting into today. So with that.
Ken Sawatsky, thank you for my 2 minutes. This again is irregular. You have only 2 topics to comment on today, and we'll be limited to 2. Probably majority of the people won't even be speaking correctly because they don't understand that this is something that's not on the agenda. Anyway, here we go. The other day we were talking about the coal train, and I wanted you folks to know that I consider this to be the grain train now. So there's something called a bait and switch, and it's autistic people work together. We throw something out there. And of course, the straw dog got the ever-living kicked out of it. But that wasn't necessarily the intent of this train that's going to be moving forward. The grain train may be hauling all kinds of wonderful products from across the United States. And of course, in my opinion, what has come forward from the motion that you had, the ordinance or whatever you passed last time, and what McGuire is bringing forward, basically has precluded you from engaging in rail banking, because you show no intent to allow future use of this railroad for a grain train or whatever you want to call it. So I guess I'd let you know, some of us autistic get together and we do set bear traps, and of course somebody stepped in them. That's why I referred to some people as dumb, dumber, and dumbest. And so now I look forward to somehow or another improving our port, doing environmental friendly things. Not necessarily up the Eel River Canyon, but maybe the other route would be better. But we do need to develop our port. It's not going to be a lagoon to the benefit of an oyster company. Thank you for the opportunity to speak.
Thank you. All right. And next we have public commenter 0151. And so this is on items not on the agenda. So 0151, please speak.
Good morning, this is Dottie Russell, and I wanted to mention that at the hearing last week regarding an abatement issue, there was no oath taken by anybody in the room, and apparently that's the way that it goes, but because some things by the county were stated that were not true, I think in the future it would be better to have everybody testifying in any, for plaintiffs or defendant, that they actually take an oath of honor and honesty to make sure that people tell the right the right thing and the truth. Another thing that happened was that it's a little bit unclear when there's a hearing that public is invited to respond. So I didn't know at hearings that that was the case. I thought they were private. So that's something that we should all be aware of as well. And then there was one of the code enforcement people was a little bit reprimanded for being too soft and too nice. So I think instead of being reprimanded, it would have been nice to actually have her have both sides ask questions of her, because I think that you would find that she acted appropriately for integrity. So I was really offended that I was spoken to in a manner that I felt was very disrespectful. I don't speak disrespectfully to any of you, and I don't expect to be treated disrespectfully by any of you either. So I think we really need to have some clarity. I don't know how to correct impositions that were said that day, last Tuesday, because I think that the county is misinformed, and it's
Dottie,
important.
We're past time here.
Okay, thank you.
Thank you. And I wanted to jump in here just to say that, like, this, I think maybe what isn't clear, and I didn't state clearly, which is this is a special meeting. We did not have a meeting scheduled for today. And so that's why we're having the procedures are a little bit different than normal. So I just want to be clear about that. So this is a special meeting. We do not have a meeting planned for today, but we have this item that we're doing. And I want to say I'm chairing today because Virginia is out of town, right? And so she doesn't have access to the office and to the staff and stuff. And so this is why we're doing it this way today, just for clarity. All right, so public commenter 2223, you have 2 minutes to speak on an item not on the agenda. Hello, we can hear you.
Good morning. This is Craig Johnson from Humboldt County, Southern Humboldt. And I'm speaking to this special meeting. I could not find the agenda. So as far as public notice to what we're speaking about, I'm really unclear. Someone did send me a text saying what it was about, but I don't know how they found out. So I feel we should have adequate public notice before this agenda be approved. And I don't feel we can even have this meeting this morning from what I see is happening. Again, I followed the Legistar links. I went to Board of Supervisors meeting, clicked on the agenda, and it was all blacked out and I couldn't even see what the meeting was about. So as far as the public being notified, I don't feel I was, and I don't feel this meeting can even proceed. Thank you.
I appreciate that comment, and we'll ask our council to address that at the end of this public comments that we're in right now. So next person on there is 3053, 2 minutes to speak about things not on the agenda. 3053.
Good morning, Thomas Mulder here. Can you hear me?
We can hear you.
Hi, so I've been checked out for a little bit, getting back in. I'm going to tell you, the board, thank you for the tax fee waivers, or whatever you want to call it, that and possible tax incentives that were approved. And then I'm going to jump into right now, special meetings. In the past, a little history lesson, special meetings would allow someone 3 minutes public speaking on non-agenda items every special meeting. You guys actually voted that you wouldn't try to silence the public when you go Zoom special meetings. So please remember that. I'm a little scared the way the next year is going to go, if this is going to be the way to try to silence the public. The public is allowed 3 minutes to speak. The time in which the public comment is limited is when the agenda item has already been before the board. So I think you need to respect the community and to respect the public. With that, I'll go on to redistricting. I was informed about the new maps. I went onto the county website or the link. Couldn't view the county links unless I filled out some questionnaire, but I read the thing on Lost Coast Outpost. Option 1 and 2 is ridiculous. We are a rural county, and I think that some of the more city areas that are represented, they need to take up some of that rural area instead of just, I don't even know how you have Shelter Cove and Willow Creek. What tax, like who's giving direction to this possible redistricting maps? It's just, I can't even believe that's an idea and why we're spending tax dollars on that. We should probably be really thoughtful there, but also really careful. I think the public needs to be really, really careful. We're meeting via Zoom. It's hard to participate, and to cut off public comment before people in the past, when we met in person, people would be talking and then other people would get up to speak. So to cut it off before it's even started, I think is not very good. And it makes me scared of this next year moving forward, if that's the way the meetings are going to be chaired. Thank you for the opportunity to speak.
And thank you for speaking today and voicing your opinion. So next is public commenter 7328. This is your time, 7328.
Good morning.
Good morning, we can hear you.
Good. Jeff Hunterlock, Operating Engineers Local 3. Welcome, temporary chair, as you put it, Mike Wilson, and all the other board members. And I want to give my comment regarding, first off, yes, I agree with Rex Bohn that the meetings, at least your part of the meeting, should start 15 minutes early so you can have all your technical difficulties worked out. I also want to bring up, because I do only have 2 minutes, I'm just hoping that this board is not considering following suit with Arcata City Council on approving hallucinogenics in city limits or even in the county. It's not on the agenda, but I don't know if y'all know, but those things are real dangerous. A lot of our mental health folks out here on the streets, that's what they do. I personally have 3 people I know that have ended up over in Central Byron, a very dear friend of mine's son. And I just don't know where we're going out there. I mean, smoking weed's one thing, but come on. What's it going to take somebody to get shot with a gun with a person having a bad trip? So I'll move on from that, because if it ever comes before this board, I'm going to be speaking a whole lot more harsh than I am here today. But the coal train, the grain train, look, whatever is going to happen here, offshore wind, port development, taking care of our environment, climate change, we need to do something here, folks. And to come against something, I'm really glad, and I'm looking forward to seeing what happens, who comes against the offshore wind, like what happened last time. I hope it isn't going to happen this time. But we need some industry here, other than marijuana, okay? We need industry here. Is my 2 minutes up?
It is. And you did, I think you got through 3 pretty solid subjects. So I would say congratulations. You did a great job. All right. Next is public comment 9782. 9782. Are you there, 9782?
Hello.
Hello. Good morning. You're, as they say, on the air.
Hello. My name is Florian, and I just wanted to speak out against any vaccine mandates for required indoor spaces. I think it's unconstitutional. I think it's a government or local government power grab to do such a thing. I think it will have negative impacts on our local businesses, considering 30 plus, maybe 40% of the population is unvaccinated and would be prevented from shopping at local stores, would then be forced to give their money to Jeff Bezos or the likes. Anyway, I'd just like to make sure I'm expressing that I am 100% not in support of the proposed vaccine mandates for indoor spaces.
All right. Well, thank you for that. And I think just want to be clear, like, didn't mention what we're actually talking about today, which is the county employees. So I thought that was tangential and not directly related. So next is public comment 1172. You are ready to roll. One 1172. You're up.
Hi. I just wanted to say that when you announced the meeting ID at the beginning, you incorrectly announced the last 4 numbers.
Oh, I did?
Yeah.
Okay. Thank you for that. And when you're talking about the meeting ID, let's see here, ID 820-7107-9635. So maybe I did those last 4 numbers out of order. I apologize if that's the case. I sometimes mix up the order of numbers. It does happen. Appreciate the correction. All right. What I thought was to be the last commenter, which is 7108, but there's one more after that, and I'm going to say we're done with public comment on non-agenda items after 6082 comes up. So 7108, you're up.
Yes, this is Bonnie Blackberry, and I just want to thank the board for having these meetings available virtually so more people can hear what's happening and be able to participate. So thank you very much.
All right, thank you, Bonnie. All right, and next on the agenda, or not next on the agenda, next is public comment 6082. You are the last public commenter on non-agenda items, and welcome to the meeting. (6082) 6082, are you there? Give a couple more seconds here since you jumped on kind of at the last minute.
Okay,
All
hello,
right.
Can you hear me? Can you hear me?
You are loud and clear.
Hello, okay, great. See, that was confusing, okay? I want to point out that you really need to get back to work and be in person. This is a diminishing of hearing our voices. This technical difficulty is unbearable and unfair. I'm moving on with my point, though, because I don't have a lot of time. I'm a mother and wife and local business owner, employing over 50 people in Humboldt County. There's no way the vast majority of the residents of Humboldt want to live with a vaccine mandate or passport. Humboldt County prides itself on natural living. People moved here to get back to the land. Nobody is moving here to get back to corporations or medical tyranny. That's not what's happening. This is not who we are. That's not what this place is about. There's nothing natural about requiring a pharmaceutical injection to participate in society or to have your job. Just listen to that idea and realize what the proposal is, okay? Requiring a pharmaceutical injection for your job or to participate in society. People are supposed to be protected by the vaccine. And if the vaccine isn't working, then why would anyone else get it? Because it makes it a milder case, that's not true. It's actually people are dying, that's not true. So even if the mandate gets rolled out, it will not encourage people to get the vaccine. It will only encourage people to come up with fraudulent papers. It's a waste of time, taxpayer money, and it's actually offensive that the program's even being proposed. It's offensive to free people, to autonomous people, to people who understand the Constitution. This is an infringement on our God-given rights, not our Pfizer-given rights. It's an infringement on our right to life, really. You're interrupting me?
Well, no, I was just saying this is supposed to be comments for things not on the agenda. So
I
if you want to
understand.
finish up, that's fine, and we'll just.
Thank you. I will finish because the whole thing's too confusing because it needs to happen in person. I urge people at this meeting to look up Project Veritas. Project Veritas is exposing Pfizer scientists who are covering up the truth and secretly being recorded saying that the COVID antibodies provide more protection than the vaccine, as well as a lot of other facts about the vaccine and the pharmaceutical corporations behind their push. So if you're interested in the real science that's mostly not being reported, please check out Project Veritas and other studies coming from other countries. We do not want to be pawns of profits of major pharmaceutical companies. We're smarter than this, at least we have been in Humboldt historically. And finally, everyone listening needs to read The Great Reset by Klaus Schwab. Read The Great Reset. These vaccine mandates and passports are step one. There are many steps
we're
to
past
follow,
3 minutes now, so.
and they increasingly get worse. The Great Reset.
Thank you. I appreciate that. All right. So we're done with public comment for things not on the agenda. So we're going to move on to the agenda today. I have a hand raised that's 2048 that has just come up, and I want to honor this person to be able to, but I just want to make sure that if I'm going to have 2048 come in, they need to make sure that they're talking about something not on the agenda. And you have 2 minutes. So 2048, we're going to let you talk. And this is absolutely the last non-agenda item speaker today.
Hello, can you hear me?
We can hear you.
Okay, this is not on the agenda, but it is about vaccine mandates. I just want to oppose all vaccine mandates for Humboldt County as a whole in general. I know this hasn't come up for the board yet, but I'm pretty concerned that it will. As we saw just last week or the week before, they were voting just for Eureka employees. See how quickly it went from just Eureka now today to the whole county employees. And then next, it's going to be the whole county. We're going to be asked to provide passports, whether it's from Governor Newsom down to Humboldt County or whatever. We're going to be asked to provide passports to go shopping soon. I just want to oppose that as a member of the public. That's un-American, unscientific, and should not be allowed in Humboldt County's borders at all. Thank you very much.
Thank you. All right. So now we will move on. So first of all, it's true. Zoom meetings are awkward. These processes are awkward. I appreciate that. I appreciate people's patience and empathy in that. And hopefully even a little bit of humoring one another in these strange times. So with that, I think we're going to move on to department reports if we can. And so if staff wants to take the lead, I'll let Alicia jump in and let's see where we take this. Thanks.
Thank you, Vice Chair Wilson. Alicia Hayes with the County Administrative Office. And today we come before your board to prepare for the upcoming holiday and winter season and likely a surge of COVID-19 cases. Today, county staff are seeking direction from your board on actions to take to help prevent the spread of COVID-19 in the workplace. Before you are 3 different options. Number 1, to remain status quo and to continue following state, federal, and public health orders. Option number 2 would be to require weekly testing for all unvaccinated staff. Option number 3 would be to require staff vaccinations for all county employees. And option number 4 would be to require vaccinations for all new county employees being recruited after all of the current recruitments that are in place. With that, I pass it off to your board for what I am sure will be a very robust conversation.
Oh, thank you. And do we have any I guess what I'm trying to make this meeting flow as best we can. I guess maybe what I'll ask for is if board members have anything they want to say to start this conversation off, we'll do that. And then after that, we'll move to department heads. And then from that, we'll move to the public. But I want to make sure that, and I don't see on my list here, Ian, our Public Health Officer. Ian, are you here? I just want to see your there you are. I want to make sure you're in the room, in the space.
Chair Wilson, I'm here, yeah.
And I would like Jefferson too, if he could be, I want him in here as well. So I want to be able to make sure that I got faces we're looking at here as we move through this. Ian, is there anything you want to start out with on this before we dive in? Is there any way you'd like to help frame this at all? And then I'm going to ask Linda Lee as well to sort of give us a little bit of framework as well.
Sure. Thanks, Chair Wilson. I appreciate the opportunity to speak on this very important issue. I think really what we're here today to discuss is specifically for your board to decide for its employees of the county how to move forward with some sort of process to verify vaccination status and what the benefits would be to the organization of that process. I'll just start off and say that we, public health, we support any efforts to increase vaccination against COVID-19. It is our best tool to end the pandemic and get us out of this. It has been working extremely effectively. It is doing exactly what it was intended to do, which is to reduce hospitalizations and mortality from this very deadly disease of COVID-19. National and statewide data really support that it's 11 times that those who are unvaccinated are 11 times more likely to be hospitalized or die from COVID-19 than those who are fully vaccinated. Some of our local data that is supportive of the strength of the vaccine were put out on Friday. Our average local age of hospitalization for someone who is unvaccinated is 57. And the age of the fully vaccinated average age is 75. So you can see there's a pretty stark difference in that age group. And I think that really speaks to how well this vaccine is working in the fully vaccinated. We really aren't seeing younger people who are fully vaccinated get hospitalized or die, but we are seeing those who are unvaccinated. For the same local data for deaths, the fully vaccinated group, the average age is 79, and for the unvaccinated group, 65. So it's really shaving over a decade off of people's lives when people are unvaccinated. So how to really think of this is we talk a lot in our schools about layers of protection that we use to protect that vulnerable population and try to keep schools open and keep kids from getting sick. And one of the layers of protection that we use is vaccination. It's one of the strongest layers that we have to reduce the impact of this disease. And so I just encourage you to consider those layers of protection for your employees and for your workplace. Another layer of protection is testing. And that's also something that is being done in schools broadly to protect that space. So, consider that as another way to increase the protection in your workplace. So I'm happy to answer any questions along the way that come up about the effectiveness of the vaccine, effectiveness of mandates, and what their place is, from a public health standpoint. So thank you for giving me the opportunity to speak.
Yep, great. And Director of Human Resources, Linda Lee, and do you have any opening remarks with regards to what we might be considering and how we will deliberate this, or any information you want to share with us?
Yes, good morning, Vice Chair, honorable board members. Thank you for the opportunity to speak before you. I will share with you from the perspective of risk management. Since March of 2020 up until September of 2020, of course, across the state, we are all grappling, understanding the seriousness of the pandemic. And of course, from the risk management standpoint is the perspective of safety in the workplace. Ultimately, in September of 2020, state legislature came out with two set of legislations that require employers to track and to maintain the record keeping for up to 3 years. So since September 2020, two set of legislations impacted us here in risk management requires that tracking is SB 1159 and AB 685. This information is included in the staff report attachment. With that set of legislations, risk management kept the data, and I would like to offer you the workplace data for your consideration. Since the tracking of in 2020 up to date, as of yesterday, countywide, we have a total of 83 cases being reported of symptomatic cases in the workplace. Of these 83 cases, it varies from month to month, and I would like to offer you two perspectives. Before June 15 of 2021, with the state reopening, the county has been operating with strict measures in place that Dr. Hoffman indicated. Those measures include social distancing, face covering. The county also promoted or instituted what we call a 60-40 footprint to mitigate the fall of the flu seasons in 2020 with the pandemic. So from December of 2020 up into early June of 2021, we are managing it very well. There are no what we call isolated breakout or in any facilities. Those breaks out defined by CalOSHA is that you have 3 cases within a 14-day period. So our data supports that with those stringent mitigation plan in place, the workplace itself is maintaining safety for our employees. Since June of 2021, with the reopening, your board opted for the self-attestation policy as called for in the CalOSHA emergency temporary standards. Through that data collections of 2,400 employees, only 957 self-attestation forms were received in risk management for a total of 37% workforce. Combined with the self-attestations in mid-June, and then the increase of the Delta surge beginning late June, early July, throughout the month of August, risk management has seen an increase of over 600% positive exposures in the workplace. The height of the Delta surge raised some concern for risk management, which I have alerted to the administrations that we need to take additional proper measures. Although the CalOSHA emergency temporary standards did not call for social distancing, it does not preclude any organizations to increase those mitigation plan. Ultimately, in late July, working through consultations with Dr. Hoffman and seeing the surrounding community cases increase, not only outside of the community, but inside the workplace, we as an employer began facial covering mandatory and social distancing. Regardless of those mitigated measures, in the month of August alone, county risk management contacted 31 cases. But since August, we are now seeing a decrease in workplace exposures. So those are the data set I would like to share with you for your considerations. Now let's step back regarding those two set of legislations. Primarily SB 1159 and AB 685 also provided the benefits to the employees who may have been exposed to cases, may also be eligible to file for worker compensations. And of those 83 cases we have exposed in the workplace since December of 2020, only 36 cases are filed for worker compensations. Those are the benefits entitled to the employees. But I offer you this data points for your considerations is that coupling with discipline of continuing mandatory face covering, social distancing, and perhaps reevaluate the hybrid work environment to ensure that we do maximize those social distancing and telework options as your board approved in your interim telework policies at the height of the pandemic. There may be some data to support the directions of your board. Regardless of the options you selected today, once a policy is set by your board, it would become a policies of practice for county HR to work through with various labor representatives, such as meet and confer. And then we would also have to evaluate how to process should we take an adverse actions on employees who choose not to be in compliance. Then there is going to be another set of processes that we also need to work through to ensure that we can expedite the process, but also have support in the front end to assist the departments in the event of you're looking at decrease in staffings in their operations. So with those remarks and data sets, I just share that with you and be available for any questions. Thank you.
Thank you, Director Lee. So with that, Alicia, are you there? So I'm just going to ask for a little advice on moving this forward in terms of, hold on, Rex, just 1 second. Do you feel like the flow should move to supervisors here or to other department heads? And it looks like I got supervisors jumping in, so that might be where we go. But I just wanted to check in with you about what your anticipated flow of information would be.
I think either flow will work just as well. And I do agree, you've got a couple board members who are anxious to jump in. So it might be good to hear from them to kick the conversation off. I know department heads definitely have opinions and would like to weigh in as well. So it would make sense to go to them and then the public.
Okay, so this is a good time for board members to jump in with questions. I know Rex, you had some, Michelle also. So Rex, why don't you jump in first?
Well, for Linda Lee, I know she said after June 15th, we had a 600% increase. What's the actual number? Is that 7, 11, 27? 600% sounds like an awful lot, but.
Thank you, Supervisor Bohn.
You're welcome.
For comparison, in June, we have 2 cases. In July, we have 9. In August, we have 31 cases.
Okay. All right. And then the other thing is you talked about all the things that your department would have to do if depending on what we implement. Do you have anywhere near the staffing to implement and have that happen? Or is that going to be an extreme burden?
Thank you, Supervisor Bohn. 3 weeks ago, I believe your board, in collaborations with the County Administrative Office, let's take a step back. I would like to clarify that. With this 2 piece of legislation since fall of 2020, there's been an increase in risk management. And during the budget process, working through with the County Administrative Office, we've identified potential positions perhaps through the CARES Act. And ultimately, we realized that there are funded positions through the ARPA. So since then, your board has approved for county HR 3 specific staffs basically focusing on the increased staffing, tracking, contact tracing, and whatever directions your board is taking today will be assisting us through those 3 ARPA funded positions. And those positions are fixed term for the specific of meeting all of the requirement reporting to the state. Thank you.
Okay. Thank you.
Supervisor Bushnell.
Thank you. Through the Vice Chair. Director Lee, I was wondering, out of the 31 positives, how many were vaccinated?
Thank you, Supervisor Bushnell. In the month of August recently in August of 2021, the California Department of Public Health issued 2 executive orders, and those orders are primarily for employees who are working in the congregate facilities or healthcare related. So from risk management county-wide perspective, there is no guidelines of mandatory tracking for vaccinated employees. So I like to qualify that. So when county risk management was made aware of an exposed case, when we conducted our contact tracing, oftentimes the employees voluntarily provided the information, so it's self-reported. We have no documentation. So in August, of the 31 cases, we have 20 self-reported being vaccinated.
Thank you.
All right. So I think we'll move to department heads that may or may not have an opinion or a voice or on this. And so if you want to raise hands, I'll just kind of roll through the Hollywood squares here. And so I don't see any hands being raised by department heads right now. Oh, let's see. Do I see anything here? No. All right, Connie, you're first to jump. So the floor is yours.
Good morning, Supervisor Wilson and members of the board. Connie Beck, Health and Human Services Director. I guess as an administrator, I can't recommend anything other than option 1 at this point. For recruitment and retention of county employees, I think we're at a critical time in this pandemic. DHHS's overall vacancy rate right now is 23%. That's 324 positions in Health and Human Services. We have a couple of the healthcare areas that are already mandated to vaccinate or test. Michelle Stevens is on, and I've asked her to talk about the work that we're doing around the the mandate and the vaccination and testing. I think that your board will be interested to hear those comments. And then I'd just like to say that out of all of our employees, 3% of employees, or 38, have tested positive since the pandemic started. So I'll turn it over to Michelle now.
Good morning. So as Director Lee mentioned, there are a couple different state health officer orders that apply to DHHS employees. And it includes contractors, interns. The definition of worker is more than employees. Of the 1,100 DHHS employees roughly that we have, 700 of them fall under the state health officer order. And we have the order requires workers to fill out a declination form. There's two qualifying reasons to be exempt from vaccination. One is a religious exemption and the other is a medical exemption. They have to provide a written statement from a physician that says that they are exempt. They don't have to say why, obviously, for the medical condition. And then how long they anticipate the person will be not able to receive the vaccine. So we have about 50 staff that either have not completed the declination form, so they're required to test weekly, or have completed the declination form of the 700. So we have about 50 people that are required to test weekly. And of the 700, we have about 50 of those folks that are also on leaves of some kind. And so when they return, they would have to go through the process of completing the declination form. Of the 50 right now that are testing weekly, we have a handful that are refusing to test for their own reasons. So we do have some situations that are requiring direction from HR on what do we do in those situations. But just so you know, 700 DHHS employees roughly are under that order as it is right now to vaccinate or test. That's all I wanted to share.
Appreciate that. We're going to move to Sheriff Hansel. You're next.
Hit that mute button. Thank you. Appreciate the opportunity to speak here today. Throughout this pandemic, I think the county should be applauded because, we've done extremely well throughout the county in how we've dealt with this. And, I think we've taken in on the county level a very mature approach to dealing with this. As we know, and we've discussed several times, that this COVID-19 is not going away. Okay. Eventually, yes, we'll have herd immunity. We'll have enough people vaccinated that it'll just fade into just being a normal flu. This is, again, going to be a while, but we are coming out of our latest surge. And yes, we did have some county employees that did test positive. That is going to be indicative of, of people getting sick at work. This happens in our congregate facility during the flu season as well, that we have people that get the flu and entire shifts come down with it. So it does happen from time to time, but all the measures that our county has put in place, the masking order, and then coming in compliance with the OSHA orders has all worked out. And our numbers really aren't that high, even though 600% sounds really high. We have managed this very, very well with the 2,000 plus employees that we have here at the county. So we've done so well. Why do we need to become more strict in the state at this point in time? I agree with Connie. I think option one is the best option for us to proceed with. Our county has a staffing crisis. I think every single one of us is struggling to retain people and to recruit people. And so you put this on us right now, and we will have people that leave our departments. You're talking about essential workers that push this county all the way through this pandemic, that showed up every day to work, dealing with this pandemic on the front lines. And now some people, for one reason or another, take the politics out of this. One reason or another, they do not want to get vaccinated. Okay. At this point in time, the county is going to say, hit the road because we want a vaccine. Make sure that all are vaccinated. And I don't think that requiring new employees to vaccine would be a good option either. We have a lot of things here. We're not talking about just coming on Monday morning at the courthouse and all the county buildings and test people. A lot of us are operating 24/7, facilities. We are, at all points of the county. We have people that deploy out of their houses and go on the road instantly. And so it is going to be a logistical nightmare for someone to actually get out there to make sure that all these people are tested, as well as discipline. What are you going to do? Are we really going to fire people for not adhering to this? And then what is the process for that to happen? As the Police Officers Bill of Rights, it takes a lot and due process to fire someone and to give proper notice. And so that is something that you all should be considering. That is going to be a very difficult process for us to do that. So I would just be very cautious to move forward. And again, I would definitely steer this county to go option one.
Thank you, Sheriff Hansel. All right, Tom Matson, Director of Public Works, is next.
Thank you, Vice Chair Wilson and members of the board. With the other two department heads, I would also recommend you stick with the science and public health orders and stick with option one. I have a lot of concerns about the money if we're going to have to pay for testing for people who make a choice. Not for those that have a medical condition that requires it. I believe we should pay if we're going to require testing. But frankly, it's It's a benefit you're going to give to all of those that are unvaccinated by their personal choice that the other county employees are not going to get. And so I would ask, if you're going to consider that option, you consider giving the employees that are vaccinated $150 a week each, to make them equal with those that are unvaccinated that are going to get their costs covered by the county. That's $3 million a year that can go a long way for roads, for buildings, for levees, for a lot of different things in the county outside of my department. So I'm very, very concerned about that option financially on the county as the department that deals with FEMA the most, thinking that FEMA is going to reimburse that. In fact, the reimbursement within 15 years, we're still getting reimbursements from 2006 from FEMA, and it is a battle for every item that we have claimed. So I would strongly encourage you to stick with option one, and if you go with the mandate, consider the equality of all the employees that did get vaccinated and why the unvaccinated are going to get $150 a week bonus while they're not. Thank you.
All right, thank you, Tom. Take your hand down. And Sean, want to jump in there?
Thank you, Chair. I would just like to point out a couple of things. One is that I strongly support vaccination, and that...
Hold on. I just need to introduce you.
Oh, yeah. Very good.
Sean Brenneman, the Director of Probation.
So I just like to point out, I do strongly support vaccination. I think it's important to remember that to varying degrees, we provide essential services to the members of the public. And so they don't really have a choice necessarily with interacting with us, particularly, in my line of work. And in the courts, they have to come to court. It's, if they're in juvenile hall, they really don't have a choice about how they interact with others. So, we have a real obligation to those people to be safe and provide them the most safe environment for them to get their necessary functions done. With that being said, I also believe that we should follow the body of evidence as it applies to managing the pandemic. And I think that manifests itself in public health orders. So I haven't heard, a public health order coming out of the county from public health that really addresses this one way or the other. This seems to me to be something that should be decided based on science and body of evidence. The other thing is I don't think that testing in general will be that effective in managing a pandemic in our departments unless it's instant testing, which I've had to have that involved in our juvenile hall, and the accessibility of that for the county-wide would be a question for me. So maybe Michelle can answer that if she wants to be put on the spot. But, I'm not sure that we would be able to get instant tests available for all our employees, and that we have a delay of 3 or 4 days to get a result. I'm not sure how we're going to stop exposures. So really instant testing availability would be essential to me. And I don't know if that's really within the capacity of the county right now. So those are my comments. I would stay with issue number 1 until we get alternative orders.
Thank you, Director. Next, I have Maggie Fleming. District Attorney Maggie Fleming is your time.
Thank you very much. I appreciate the board giving us the opportunity to speak. As said before, I agree with option 1. Similar to Chief Brenneman, I'm very, very strong proponent of vaccinations. I'm vaccinated, my family members are, but I also recognize that for many, this is medical or for other reasons, they have some concerns and issues. And I think mandating it will affect our ability to recruit and retain people. As said before, we are all short-staffed and working hard to try to keep our staffing levels up. The DA's office was open throughout. We have very strict rules for people coming into this office, temperature taking. Every item here is cleaned daily, and we have worked really hard, and we have had really good luck. And I just know how much this would mean if we force people, some of whom are opposed to it, to get vaccinated. Going through attachment 1 and looking at other counties, what I noticed is very similar to the conversation we're having here, is sort of where a number of them went. And specifically for those, repeatedly it says require employees, but if they're not vaccinated, then they must test. So I think it's similar throughout the state, these same issues, and I appreciate your time. Thank you.
All right, thank you, Maggie. Mr. Bartholomew.
Morning, John Bartholomew, Treasurer Tax Collector. Thank you for addressing this topic. And I agree with all the comments that have been made by other department heads. I think that option one, to remain status quo, is the way that the county should stay. As Director Beck mentioned, staffing is very difficult. We're down 20% in this department. And that said, we've been fully manned since May 1st of 2020, and operations have been going quite smoothly. And we do let the public into the department for making payments for various property taxes, et cetera. We do have the acrylic barriers up, and staff are safe, wear masks, and we are fully functional as is. And I would hate to put more restrictions on staff now and potentially have additional personnel difficulties within the department. So I appreciate this discussion and the various options that were put forth in the staff report, but I think that we are functioning well as in the current status quo. And so I would recommend that we stay as is. Thank you for the time to speak.
Thank you, Mr. Bartholomew. I'm looking to see if there are any other directors that have a need to speak on this item. I don't see any, so I'm going to bring it back to the board if there's any clarifying questions or comments, and from there we'll move to public comment. So we're going to be moving to public comment here in a minute. So folks, I want to, anyone who's out there who wants to speak to this is a time to raise your hand, as mentioned before, and you'll get the full three minutes. No, there's no restrictions or any on that. So please be ready to jump in. So I'm hoping people can get in there. So start coming in, and we'll be in there in a few minutes. So I see Chair Bass is ready to speak on this item or have questions or something.
Thank you. Actually, no, maybe I have some questions, and I don't know if anybody from staff really cares to tackle it yet. And if not now, perhaps when we come back from public comment. We're hearing a lot of anecdotal evidence about people quitting jobs because of mandates. And I will be curious to hear after we come back, do we have any actual real numbers? Are those quantified yet from other agencies? I know a lot of this is still very new. City of Eureka, I believe theirs is not totally in place yet. There's some time still to get, I think, exemptions. Other people are quitting. I'm really curious to see what happens with their workforce when the exemption time runs out. And I'm just looking for some, instead of anecdotal evidence, some actual numbers that people are seeing in the state. And then someone else brought this up also, and this is for later, I suppose. It seems like there's certain departments that we've been hearing from, not departments necessarily for our counties at all, completely, but for all counties where it seems like a lot of the folks in the DHHS and law enforcement are really averse to having any changes or doing things. So it's just an interesting perspective when you talk to folks in the public and what everybody's hearing, and it's hard to really clarify what is, because this is all so new for people. And just for people who called in, I do not believe this board has had any proposals regarding vaccination for public members and going into public spaces. I did want to clear that. I had someone send me an email that said, does that mean I can't leave my house? And that's definitely not something we are considering. So I just want people to be aware of that. So I see the sheriff has his hand up. He might have some actual numbers he can provide. Thank you, Mr. Vice Chair.
Yeah, and so I see Sheriff Hansel has his hand up to, I guess it's in response. So great, and I'll get to you, Supervisor Bushnell, right after there's the response from staff.
Thank you. And just to answer Supervisor Basso's question, just so you know, we have received a lot of inquiries from cities and counties that have put vaccine mandates in place, and we actually are having people apply to us because their current employer is requiring vaccines.
Okay, thank you.
Okay. All right, Supervisor Bushnell.
Thank you, through the Vice Chair. Just had kind of a question and a statement with the testing. When I asked Director Lee earlier, she said 21 people had stated they were vaccinated, that leaving 9, I believe, or 10 that were didn't say or weren't vaccinated. So with the idea of testing, the idea is to not have people come into our work area that are testing positive, but if we're only testing the unvaccinated, sounds like the spread is just as much with vaccinated people. I'm just wondering our thoughts on that.
All right, so maybe that would be a question for Director Hoffman.
Yeah, thank you, Supervisor Bushnell. Great question. So our, evolving understanding of how the vaccine impacts spread of this virus among those who are fully vaccinated, did change with this recent Delta variant. Before that, we really didn't see very much spread at all among the fully vaccinated. With Delta variant, we are seeing spread among fully vaccinated. What I will say is that the symptoms are significantly less, and I point back to the data, the local data on hospitalizations and death, which very clearly point out the difference among those two groups of the fully vaccinated group and the unvaccinated group. Symptomatic overall symptoms are much less in the fully vaccinated group. And the data is suggestive that the spread from a person who is fully vaccinated to someone else is significantly less, at least 50% or more less than if someone is unvaccinated. So there are benefits to slow the spread. Those numbers that Director Lee mentioned certainly might suggest the opposite, but it's a very small subset of people. So when we look at a larger group, other than just the data that was collected by our local county HR, the data is strongly suggestive that the vaccine will slow the spread of this and have an impact.
Thank you, Dr. Hoffman, but the idea is to not allow anybody in our buildings that is positive. So, and I understand what you're saying in a large subset, but we're not talking about that. We're talking about our county employees. Thank you very much for your answer.
All right, do we have any more questions from supervisors? All right, I have a question with relationship to sort of the federal and state trajectory, I guess you'd say, either for Mr. Hoffman or Director Lee. What do we see there was last week or maybe the week before, there was the federal requirements coming with relationship to vaccine or test. And do we anticipate that is going to, I guess, precipitate with regards to the state of California? And do we see that Cal OSHA might also be moving in that direction, whether or not, whatever our decision is today? All right, we got some hands up. And I go to Jefferson first because I always go to the attorney first. So,
thank you, Vice Chair Wilson. This is touched on a little bit in the agenda report. Obviously, the president has asked that emergency regulations are issued by OSHA, which currently would not apply to government employers, but California has its own OSHA plan. that is required to be as effective as the federal plan and does apply to government employers. So depending on the timeline of what the federal OSHA does, it is likely that that requirement will filter down to Cal OSHA. But again, I'm not sure on the timeline. And it is likely that it would apply to employers like the county, and it would be a test or vaccine mandate. But again, the timeline on the adoption, both by the feds and by Cal OSHA, is not quite laid out at this time.
Okay, I appreciate that. And so that I mean, I think that answers my question with regards to that. But in terms, we have in our agenda pack, we have a list of counties that have, taken the step of doing a vaccination or test. And do we have any kind of accurate count of how many of the counties or, the state's population necessarily that's under that in terms of like county employees versus, and maybe is there any understanding with relationship to other municipalities or jurisdictions? And maybe I'll throw this to Director Lee. Are we seeing, we have a list in our packet, but would we expect there's probably more than that, right, that have taken that direction?
Thank you, Vice Chair. At the state level, 58 counties, the practices vary from county to counties. And certainly this is a snapshot that was talked with in my state associations. From the city's perspective of 453 cities, we've also varied of how they move forward with this practice. So the data is what we have provided to you in the staff report. I would also like to echo what County Council Billingsley said regarding the federal legislations. At the state Cal OSHA perspective, there is the initial draft being circulated, and the proposal in the Cal OSHA is pretty much will be replacing what they call the temporary standards that we are under the issuance since June. So I would anticipate Cal OSHA standards will change drastically in the coming months, and that will impact how we move forward to be in compliance with Cal OSHA. Thank you.
I appreciate that. And are we seeing any movement from risk management? This is again for Linda and maybe for Ian. In terms of insurance, our providers, our carriers, are we seeing any sort of trend with relationship to vaccinations requirements and insurance? Because it was brought up by one of the directors, like if an agency chooses to do vax and testing, it comes at a cost, and basically an agency would be giving it some kind of almost, I guess someone might consider a benefit to those who choose not to vaccinate and be tested, because it's going to be it costs money to do so. So I'm just I'm wondering, are we seeing any sort of trends in providers with relationship to this? Are we going to see different insurance rates associated with vaccinated and unvaccinated people?
From risk management standpoint, we are currently doing open enrollment at this time, and to my knowledge, there's been no change other than increases in rates because of the cost of doing business. But specifically to mandatory vaccine, I don't have the information in front of me, but I am not aware that insurance carriers is making that as a mandate. But I will verify the data.
I appreciate that. So what you're saying is we are seeing increases in our rates associated with the overall impact of COVID. So everybody's paying for that. So I guess that's what we're talking about. So I'm going to move to public comment here. I think it's a pretty good time to do that, and we'll get back into our discussion. And so I'm just going to, if you get your hand up, we're going to flow through as many of these as come up today. Again, please, if you can, stick to the what we're talking about. And Director Hoffman, I'll make some time for you before we jump into public comment if you have something you want to say. I saw your hand up there. And so full 3 minutes. I apologize if there was some anxiety about truncating the public comment on non-agenda items. We'll see what we can do to make sure there's a robust discussion here coming up. Director Hoffman, did you have anything you wanted to add before we jump into that?
Yeah, thanks, Supervisor Wilson. Just to add on to Director Lee and Jefferson's point on the OSHA. I think that we will see probably in the coming weeks to month that coming down from OSHA from the federal level, and then again getting filtered down through Cal OSHA. So your board should expect to see that, and there's a likelihood that this will come up again, despite whatever you decide on today. And then just a couple of other things to add on to the conversation. Chair Bass asked about, evidence for loss, of staff due to these. And while it's really hard to know exact numbers because it's still really early, most of the mandates that were put into effect early on in August are only now going into effect fully. But what we're seeing is that across the country and across the state with these mandates for a full vaccination mandate with only exemptions for personal belief or a medical exemption, a pretty wide variety. Some companies only losing a small handful of staff, but the numbers that I'm seeing kind of across the board are around 1% to 2% of staff leaving. Now, again, it's early on, so we don't know how that might impact other organizations as this is adopted more broadly. But that's where it stands right now. Thank you.
All right, thank you for that. All right, we are going to jump into public comment. We do have a pretty solid lineup, so if we can keep it to 3 minutes, we'll do our best. And I got staff doing timer. I'm going to try and do one myself here, so see what we can do to do that. And so jumping in, again, if this is, what we're talking about is the county's discussion about the county's potential requirement for vaccination and or testing related to public employees. So phone number ending in 1172, you are first up to talk.
Hi, my name is Catherine Gabaton, and even though we may be on opposing perspectives of this conversation, I know that all of us have the health and safety of ourselves and our community in our hearts. So I'd like to address the fact that these mandates are being voted on based on the assumption that these mRNA injections are safe and effective, when the only absolute effective thing about them is how often people parrot that propaganda punchline. VAERS, which is the Vaccine Adverse Events Reporting System, has received more reports in the last year than in the past 20 years combined. This should be a huge red flag for anyone making decisions regarding the mandating of this mRNA injection. On top of that, the corporate pharmaceutical companies that make the mRNA injections are completely free of liability. Why the liability protection for a safe product? While we're told that these injections undergo rigorous scientific scrutiny, we all know that they skip the animal trials due to the perceived urgency of the pandemic. All cats and ferrets in previous mRNA animal trials perished. You might be under the impression that we are uninformed, but that's where you're gravely mistaken. mRNA injections have never before been approved for human use and are currently still in the clinical trial phases. Some of the trials are scheduled to finish in 2023. Since these injections are inevitably unsafe, which is why the government has granted pharmaceutical companies the ability to operate liability-free, I encourage people who are being coerced into taking these injections to have their employers sign affidavits of liability in case something were to happen to them. Their families wouldn't be left to cover medical or funeral costs on their own. Regarding the effectiveness, We're learning with the increase of breakthrough infections, as well as the new recommendations regarding boosters, some say as often as every 6 months, the anti-vaxxer apprehension regarding the efficacy of the mRNA injections should be addressed. If it's as effective as you claim, why isn't it working? I'm up here today so I can tell my children I did not remain silent. The definition of the word coercion is the act of pressuring, intimidating, or forcing someone to do something that they do not want to do. I don't expect that what I've shared today will change your minds. I assume that you've already made up your minds on how you will vote, and I expect that some of you will vote in favor of this proposition. But I just want to inform you that you're in violation of the Nuremberg Code, Section 1, which states that a person cannot be coerced into participating in a medical experiment. And now, you won't be able to claim that you didn't know. Thank you.
All right, thank you very much. Next speaker from the public is 2048. 2048, you ready to go?
Can you hear me?
We can hear you.
Okay, so I just want to know if, the county is going to be willing to pay for the adverse events that could happen to somebody who receives one of these experimental injections. I personally have somebody in my family who received one of these experimental injections, the Pfizer mRNA shot, and now has myocarditis and is on a blood thinner as well as a heart medication for the rest of her life that is also made by Pfizer. This drug is $80 a bottle for her to get. So I'm just throwing this out there. That's something that people who are in favor of mandating vaccines is aware of, that these adverse reactions are happening. They are happening in our county and in the families of our community members. And you guys should just be prepared to provide support, provide care, provide financial support to these people who are being harmed by this vaccine and who may be harmed by it in the future. Like the previous speaker was saying, booster shots every 6 months are going to be, thrown out there as if it's something safe and effective to do, when we don't even know how safe and effective this vaccine is, since it's been tested for less than a year on humans. So just throwing that out there, y'all need to be prepared for adverse reactions and be prepared to care for your community members, your employees, and pay for the medications that they're probably going to need after they experience adverse events. Thank you very much.
All right, thank you. Next public speaker is 0116, your number ending in 0116. You have been here, you can talk now. 0116, are you there?
Hello, can you hear me?
We can hear you.
Hello, my name is Ash Cheater. I am a member of the Humboldt Freedom Coalition, HumboldtFC.com. I have lived, worked, attended school, got married, and even had a child in this county for over 20 years now. My wife is set to lose her job on the 19th of this month because the city of Eureka did not listen to reason in their hearing on this same issue last week. If you pass this in Humboldt County, my family and many others will be forced to leave this county, likely to another state that recognizes individual liberty and the constitutional rights that every American is born with. Just recently, on October 7th, a U.S. Court of Appeals for the Sixth Circuit in Cincinnati, Ohio, held Western Michigan University's vaccination mandate likely violated unvaccinated athletes' First Amendment rights. Case number 21-2945. This ruling sets a precedence for other rulings that could possibly be used in the wrongful termination cases. This could be very expensive considering that approximately 45% of the county remains unvaccinated. The money the FDA received to grant Pfizer full approval led to 2 FDA officials resigning because they did not agree with the monetarily compromised decision-making process taking place. Similarly, a brave employee standing up against this monetary coercion in the CDC went whistleblower, claiming that the virus data and the vaccine deaths has been manipulated, with the actual deaths ranging over 45,000. Testifying in an Alabama case 221-CV-00702-CLM under penalty of perjury. Also, a Medicare whistleblower claims that almost 50,000 deaths after COVID vaccination have occurred in the Medicare system alone. Monetarily motivated decision-making is occurring here in our community, where schools are being paid to push this agenda on students. Our local medical systems are being paid to only follow the misguided and misinformed CDC guidelines. The Eureka City Council was paid to implement vaccine mandates on city employees, and now through federal or state COVID funding, you are being paid to implement these mandates on county employees. All I can say is by now, I'm guessing that many of you might suspect there are possible health risks involved with these so-called vaccines. Where there is risk, there must be choice. Though it may seem that there is no other way forward, that our county cannot survive with this path paved in COVID funding, this decision is a mistake being made for the wrong reasons. It is never too late to admit a mistake, and the lie only makes things worse the longer you keep telling it.
Also, I'd like to add that my grandma is dying from congestive heart failure after taking 2 doses of the Madrone vaccine, just like as seen in the HHS Project Veritas whistleblower. Thank you for your time. Please do not do this.
Thank you. All right, so next we have a commenter, 8635. So 8635, you're being moved to the top of the line here, and unmute yourself, please. 8635. You have your phone number ending in 8635. We're waiting for you to unmute. Are you there? 8635. All right, we're going to move on to the next public commenter, which is 7749. Can we bring on 77? I apologize. 8635 is unmuted, so we're going to let you go, and we'll do 7749 here after that. So 8635. And can we mute 7749, please? Thanks. 8635, can you jump in? Are you there? 8635, you are unmuted, and are you going to speak?
Can you hear me?
We can hear you.
Yeah.
You're there.
Okay.
Gotcha.
My name is Ben Jacob. I've been a Humboldt County resident for most of the last 22 years. First, let me dispel the myth that this is only on the political right that are opposed to these mandates and vaccine rollout. I have voted for progressive and green candidates since 2004. I was on the Arcata Square on February 15th of 2003, marching against an illegal war in Iraq. And I will say I was right then, and I am right now. I'm speaking to you today about the failure of public health messaging for COVID-19 prophylaxis and early treatment with proven supplements that are readily available and make vaccine mandates unnecessary. Very early on in the pandemic, a strong signal indicated that vitamin D deficiency was playing a major role in those being hospitalized. Since then, data has shown that nearly 85% of those with severe cases of COVID are lacking in vitamin D. Alongside that, numerous preprint and peer-reviewed studies have recently come out to show that quercetin, combined with zinc, vitamin C, and vitamin D, are extremely effective in early at-home treatment. Quercetin is a bioflavonoid found in kale, tomatoes, broccoli, asparagus, raw red onion, red grapes, cherries, and green tea. Quercetin acts as a zinc ionophore, transporting zinc through your cell membrane. Zinc then works to inhibit viral replication, resulting in lower viral loads in the initial phases of the virus. The lower the viral load, the less likely you are to have a severe case. Quercetin can be found on shelves in many stores throughout our community and online, and protocols exist for prophylaxis and early treatment. So why haven't we heard about this? 20 months into the pandemic, and early treatment to date is still the same as it was in the first week. Stay home. If you can't breathe anymore, come to the hospital. This is killing people. Imagine, though, if tomorrow we wake up to the CDC, the NIH, and Fauci saying, we have discovered a regimen of vitamins and supplements that are extremely effective in preventing and fighting COVID infection. Alongside that, it has been discovered that there are about 6 drug treatments for early and severe COVID that are more effective and that are less costly than current protocols. There is no longer a justification for early emergency use authorization for vaccines. There is no need for mandates, passports, or boosters. I think some very large corporations are going to lose some big contracts and take a massive stock hit. Now imagine for a moment if from the start we are given the same bombardment of messaging the vaccines have received, but with vitamins and healthy lifestyle choices instead. How many thousands would have been saved? How many in Humboldt would have been saved? You all have the info now. Quercetin, Quercetin. Do your research, inform our community, resist this unscientific authoritarian push of an experimental, leaky pseudo vaccine with unknown long-term side effects and well-known short-term side effects. Humboldt deserves better. Stop this blatant coercion that violates the Nuremberg Code with mandates. Thank you.
All right, thank you. So next is 7749. Sorry about the confusion there, but 7749, you are up to roll here.
Hello, good morning. I don't have a speech prepared, but I just wanted to say that I really agree with what Maggie Fleming had said. I support vaccines. I agree with science, but I also don't believe in forcing anyone into anything like this. And as far as testing, I think that we should all just be getting tested, because I mean, it is people who are vaccinated are still getting it, and there is a chance that they can still spread it. So we should just all be, as vigilant as we were in the beginning of the pandemic, and getting tested and just taking care and wearing our masks and taking the precautions necessary without forcing anyone into anything. And that's all. Thank you.
All right. Thank you for that succinct comment. And moving on to 1075. So the number ending in 1075, this is your time to talk. 1075, please press *9.
Hello, can you hear me?
We can hear you now.
Can you hear me?
Yeah, loud and clear.
Great, thank you so much. Thank you to the board for this opportunity to provide public comment. My name is Christina Gers. I am a retired utility worker and certified technical instructor. My question is this: is the board at all concerned with the trend in litigation that is taking place throughout the world regarding this unique and highly questionable response to the SARS-CoV-2 virus? These litigious trends should concern the board, as the courts are addressing these anomalies head on. For example, on November 11th, 2020, a Portuguese court of appeal held that if misused, the PCR test would have a reliability as low as 3% for the detection of SARS-CoV-2 and a false positive rate of 97%. In fact, Kerry Mullis, the inventor of the PCR test, was very vocal about the PCR test deficiency in this context before he died in August 2019. The PCR test is in fact an amplification device, not a detection device. The Lisbon court held that if a person has a positive PCR test at a cycle threshold of 35 or higher, as is the case in most laboratories in the US and Europe, the probabilities of a person being infected are less than 3%. The probabilities of the person receiving a false positive is 97% or higher, yet Humboldt County continues to use the PCR test to drive the narrative. In Alberta, Canada, the chief medical officer was unable to produce an isolated sample of the SARS-CoV-2 virus under court subpoena. In other words, the Alberta, Canada chief medical officer was unable to provide 100% proof that the SARS-CoV-2 virus occurs naturally and outside of a lab environment. I have submitted FOIA request 21-765. We will see if our health officer can produce proof positive of any naturally occurring instance of the SARS-CoV-2 virus for which they have upended Humboldt County and its residents. Finally, South Africa's constitutional court is in over proceedings that might very well establish South Africa as the home base which to begin the Nuremberg 2.0 trials for the crimes against humanity committed against the populace in the name of...
Cut this, thank you. I really appreciate people sticking to 3 minutes. It makes it fair for everybody. And also knowing ahead of time that we're at 3 minutes, if you're recording your comments, maybe time them, that would be helpful. So next commenter is 5300. That's public commenter 5300. Please unmute yourself.
Yes, can you hear me?
We can hear you. You're a little bit quiet, so maybe if you can speak up a little bit.
Okay, hold on.
What's the number?
5300. Somehow I have two 5300s on here, which is an unusual thing to occur. I apologize. So let's staff, could you mute one of the 5300s? Okay, I apologize. That has not happened yet. Two numbers with the same last four digits. All right. So go ahead. One of the 5300s can speak, and we'll respond to that. So.
Okay. Am I in? Am I
yeah,
on?
it's you. Yes, it's the I would say yes, you're in.
Okay. Start the timer.
That's all right.
So this is yeah, no worries. So this is Adam Lustig. You know me from constant emails I send you guys. What I'd like to do is address the basically misinformation and manipulation of data that Dr. Hoffman's been doing now for months. Just to recap, in early July, we were told, if you get the vaccine, you won't get the virus and you can take your mask off. Then it went down to, well, you won't get hospitalized. Then that wasn't true. Then it went down to, well, you won't die. And now 5 of the last 8 deaths in the county were fully vaccinated. So now we know that's not true. So, in 3-4 months here, we've seen a complete, backtracking of like what the vaccine can actually do. So, I'm curious, like, what's it going to be 3 months from now? And I don't see the rush to jump out with any sort of mandate. And, I think it's funny that now the position is, well, the average age of the people that died. Well, if you look at vaccination rates, they're highest amongst older people. So of course they're going to be, the average age amongst the people that died is going to be higher. I mean, that doesn't mean it's working. We just keep backtracking and try to pretend like this thing's working, and it's not working. And we can see the data from Israel showing that it doesn't work very well against the Delta variant. That's been published and admitted all over the place. So, and Dr. Hoffman said, well, the Delta variant is the dominant variant now. So, there you have it. It's not very effective. And, I'd like to highlight Rex Bohn's stories to show that, just because you're vaccinated doesn't mean you transmit it. He got it, but he wasn't symptomatic. But let's say he didn't get tested, then he'd be walking around asymptomatic, just spreading it. So actually the vaccinated with their lower symptoms are more likely to be spreading the virus. So the point of testing unvaccinated makes no logical sense whatsoever. And, Iceland has now stopped using the Madrone vaccine for all residents. Other Scandinavian countries have limited it for people under 30, all because of the myocarditis. So as time goes on, we keep seeing more and more issues with the safety of the vaccine. So again, no reason to mandate this for anyone. And also he mentioned that they're doing personal belief exemptions with some of these mandates. I mean, I've yet to see where they're doing that. There's no personal belief exemption with the Eureka City mandate, and the medical exemptions are really hard. And everybody I know has done a religious exemption has been denied. So this idea that there's some sort of rational exemption, that's not true. We've had more people die this year of COVID with vaccines than last year when we had no vaccines. And also I'd like to highlight that the 871 LA firefighters are suing the city over their mandate, and they're looking for $2 million a person.
We're at 3 minutes.
Okay, thank you.
All right, thanks a lot for your comments. All right, so we'll take on the next 5300 if you're still there, and if you want to speak. So 5300, the other one, because we can't see the prefix. You're up. So if you want to talk, this is your time.
Yes, good morning and thank you. This is Megan Yarnall. I'm a resident of Humboldt County and a small business owner here. I'm talking to you today to urge you to require vaccines for county employees. As a small business owner, I understand your concerns about staffing our agencies and losing valuable personnel. The reason I wanted to talk this morning is because I just read a report by NPR. They reported research the end of last month on September 29th that shows that while half of unvaccinated workers say they would quit if mandated to get the vaccine, in fact, very few of those people actually quit. So in other words, the research showed that vaccine mandates are unlikely to result in a wave of resignations, but they are likely to lead to a boost in vaccination rates. Now, I know there's been some questions about what data we have. on whether vaccine mandates are effective in encouraging people to get the vaccine. And I know that's limited because vaccine mandates are new and they take a few months to become fully implemented. But we are seeing data from the corporate world from some of the early requirers of vaccines. United Airlines has 67,000 employees, and the number of employees facing termination for refusing the vaccine was 320, so very small. A North Carolina-based healthcare company, Novant Health, has about 35,000 employees and achieved a 99.5% vaccination rate following a vaccine mandate. Tyson Chicken recently required U.S. employees to get vaccinated. That they announced that on August 3rd. And 2 months later, they have 109 out of 120,000 employees implemented or vaccinated. And at the time they announced the vaccine, only about half were vaccinated. So, from the corporate world, we're seeing that vaccine mandates are in fact effective at getting people vaccinated. To speak to Sheriff Honsol's anecdotal evidence of applicants or phone calls from other officers who are upset about vaccine mandates, those phone calls don't mean those people are actually leaving their job. Finally, vaccine mandates aren't new. All schools require vaccines for children as well as, college students. Many workplaces like hospitals, doctors' offices, and nursing homes do as well. And they've done so for a long time, since long before this pandemic. Mandates send the right message to the public that vaccines are safe and effective. So thank you so much for your time and consideration. I know this is a difficult issue for you, but I'm just speaking to encourage you to choose option 3. Thank you so much.
All right, thank you for the comment. And so the next public comment we have is from 1954. So if your number ends in 1954, you are up, and please unmute yourself.
Hi, my name's Catherine Wallman, and I'm going to just do a little more addressing of the Nuremberg Code. And I've just shortened a few of the phrases that are in there just to make some points. And the voluntary consent of the human subject is absolutely essential without the intervention of any element of force, fraud, deceit, duress, overreaching, or other ulterior form of constraint or coercion. Point number 4, the experiment should be so conducted as to avoid all unnecessary physical and mental suffering and injury. My comment, as of September 17th, 2021, the government's Vaccine Adverse Events Reporting System, commonly known as VAERS, has reported 726,965 adverse events, including 15,386 deaths since December 14th, 2020. It is also known through a study conducted by Harvard University that only 1% of actual events are reported. Point 10 of the code. During the course of the experiment, the scientist in charge must be prepared to terminate the experiment at any stage if determined that a continuation of the experiment is likely to result in injury, disability, or death to the experimental subject. There's an excellent video on the Doctors for COVID Ethics website where the European Medicines Agency is presented with a document based on the Nuremberg Code created by Holocaust survivors and their descendants, calling the vaccination program a second Holocaust. And I recently watched an interview with an Israeli citizen. Because he has chosen not to get the experimental unlicensed vaccine, he is denied access to the Holocaust Museum. How sad. Thank you.
Thank you. Next, we have commenter 1041. So if your number ends in 1041, we're putting you on there. So looks like you're unmuted, 1041.
Good afternoon, Madam Chair, Supervisors, supporting staff, and participating members of the public. My name is Donnie with Humboldt Freedom Coalition. Thank you to the board for this opportunity to provide public comment. I have grave concerns regarding the health officer's written report, and I submitted a detailed point-by-point rebuttal document to the supervisors for consideration. The report claims, quote, "There is concern that this surge won't end the same way as others have and will continue to decline much more slowly than previous surges, possibly lasting well into the next year. However, this assumes that state confirmed cases are the factor for concern when, in truth, hospitalizations and deaths are the true measure of the health crisis. While this current surge has occurred, the fact that 99% of those cases fully recover, as shown on the county's COVID-19 dashboard, and are represented by cleared cases, all people who survive gain robust immunity lasting up to 250 days and basic immunity for a lifetime. This all begs the question why great news like this wasn't part of the report. To make matters even worse, this rapidly declining surge was among the fully vaccinated as well as the unvaccinated. All current data clearly indicates the currently available COVID-19 vaccines are not efficient at limiting or stopping the spread of COVID-19. Any proposals to mandate them ought to be met with swift refusal. The report claims COVID-19 cases rates have dropped to the lowest rate they've been in the past 2 months. However, case rates remain very high, higher than they were during the peak of the previous surges, end quote. This is clearly false and deceptive. Via the documents I've submitted, the case count since the peak of the recent surge have dropped at an exponential rate of 1% per every 24 hours. We can expect this observed decline to trend to continue as there are no indications to the contrary. The document I submitted, which can be found at HumboldtFC.com, clearly shows 40 cases per 7 days average back in mid-January winter compared to 28 cases per 7-day average now. This represents a 67.5% delta between the severity of the two time periods. Clearly, the recent surge of cases are in steep decline and are not higher in the present moment than in the past. Going further, all age groups under 59 years of age have a 0% mortality rate and less than a 5% chance of hospitalization, despite zero of the proven early outpatient theories practiced elsewhere being offered to the sick people of Humboldt, which would obviously reduce these numbers. The county's data is based on recorded cases, collected cases by the state, which does not include rapid home tests, mild cases, people who just stayed at home sick. These are groups that never get entered in the state database. It is safe to estimate the true total number of positive cases is 2 to 4 times what is shown by the county. In other words, hospitalizations and death percentages based on records we can generally rest our hats on can be divided by multiple factors. Therefore, it's clear the current COVID-19 mitigation mandates are unwarranted and need to be immediately revoked. Furthermore, all of what I said, as well as the entirety of my rebuttal document, stands as public record showing the written report as an intent to deceive the Board of Supervisors and the public. The health officer is derelict in his duties and needs to be removed immediately, and his advice disregarded outright.
Thank you.
All right. Thank you. So next is public commenter 6709. 6709. This is your time to speak. And please unmute yourself. *9 6709. All right, 6709. Are you ready to unmute? If not, I'm going to move on to the next commenter and we'll get back to you later. All right, we're going to move on to 5457. 5457, please unmute yourself. And staff, could you put 6709 back down into the queue? So 5457, this is your time to speak. Please unmute yourself. Anybody? Are we having technical difficulties? Because I got a
Supervisor Wilson, sorry to break in. You might want to just remind people *6 to unmute. Because I think maybe people are fake. I think you might have accidentally said *9.
I did say *9. I apologize. Right. So I got 5457 *6. Please unmute yourself. There you go. And then we'll get to 6709 after that. So 5457, we can hear you.
Okay. Thank you for this opportunity to speak. My name is Lori Birdsall. I live in Arcata. I'm very concerned about this mandate. It's a slippery slope. As the actual science shows, the unvaccinated are just as susceptible and spreading the Delta variant as the vaccinated are just as susceptible and spreading the variant as the unvaccinated. Requiring people to get vaccinated in order to keep their jobs goes against people's human, civil, sovereign bodily rights. It goes against the Nuremberg Code. A person who has sensitivities, who knows that this injection would harm them, should not be coerced. The vaccine has been made available for people who want to get it. That's fine. People should not be being coerced to take something in their bodies that they don't believe in, that they know would cause them harm. The data on from VAERS has already been explained to you folks. I believe Hoffman is deceptive in his narrative. This is not what I want to see happen in our county. It threatens our civil liberties and our constitutional rights. Thank you very much.
All right, thank you. So next we're going to try again for 6709. So 6709, star 6, and it looks like you've got it. So
hello. Hi, my name's Sarah. Can you hear me?
We can hear you.
All right. Thanks for allowing me to speak today. I just want to reiterate the fact that if this vaccination mandate push is for immunity, why is nobody considering natural immunity? I know a couple people have touched on that, but just for reference, there have been over 8,000 positive COVID tests in our county so far. This isn't counting the people who had contracted COVID before tests were widely available in our county. It also does not account for anybody who, may have had minor symptoms, who didn't feel like testing, or people who are hesitant to get tested for numerous reasons as well. As Donnie mentioned as well, natural immunity is robust and long-term. And if we are willing to test people to prove that they don't have COVID, why aren't we testing people to prove they have natural immunity? It seems like it would be just as effective in giving people, yet another way to prove that they're immune and not a threat to our community as far as COVID is concerned. I also want to touch on the fact that, as Adam mentioned, I believe there have been several
3 minutes. So if you can summarize, that'd be great.
Yeah, that's it.
Okay, great. Thank you for that. All right, so the next person to jump in will be number ending in 0151. 0151. You have 3 minutes again as a reminder. So we're looking forward to hearing what you have to say.
Hello?
Yep, we can hear you.
Hi. Okay, I'm Babette Chris, and I live in Humboldt County, and I want to thank Michelle Bushnell because I agree with everything that she said to save time, and also because the vaccinated can still transmit the virus. It seems like you'd be safer with somebody who's unvaccinated that's being tested rather than with a vaccinated person who can also transmit the virus and they're not being tested. I don't even think they can be tested because I think it screws up the test, which the inventor of the PCR test also himself agreed is not even a good test. So all of that out there, I just want to say that, the ultimate loss of freedom is to not have a choice of what you have injected or put into your own body. And I just want my grandkid to know that I said something. I agree with all of the above. We should not be made to forcibly put something in. It's not even like it's going to help the transmission. That 50% that the gentleman mentioned, that's just some statistic. Yeah, we are real people. That 50% is not good enough. And I'd like to find that source and really, scope that out before anybody bases anything on that, because some of these tests and a whole lot of this information is just not being accurate. When the inventor of the PCR test himself said, this doesn't work, what are we basing everything on? That's
right. Is that it?
Yeah. And one more thing. Congress just voted down the mandate for them. Seriously? We're going to mandate our families, our people here? Thank you, Chair Council, for caring about the people here also. But Congress isn't going to do it. But we're going to make people who don't want to do it here, who've already been through the whole thing, saved up everybody's asses, unvaccinated this whole time. They've been there on the front lines, and you want to make them feel like they have to quit or be coerced into it? Mm-mm. No. That's my piece. And I really hope, and I love our county. I love that everybody is smart here. And I really hope that we continue to be that way and care for each other and not make people do things to their bodies they don't want. That's not even going to help you.
All right. Thank you so much for those comments. The next public commenter is going to be the number ending in 9800. 9800, this is your time to talk about this subject. 3 minutes, please.
Hi, my name is CJ Sardi. I'm a social worker here for Humboldt County Child Welfare. I just wanted to make a couple points. I asked that these things be considered. Per the data stated already, people that are vaccinated are still getting COVID, and it should be our body is our choice. Number two, please consider how short-staffed we are. Our job is very difficult. Not everyone can do it, and we already are seeing low staff as well as staff leaving on stress leave for this pandemic already. I think it's just a lot that's going to be on top of what already is our job. And number three, I just want you to think of the families and the kids that we deal with every day in our community as a whole. If we mandate this vaccine for county employees, I do believe that we'll lose employees, we'll be even more short-staffed, and we'll continue to see our families and kids get the brunt end of it as they won't have the supports that they are needed. So I'd just like to thank the board for letting me speak and to please take those into consideration. Thanks.
Great. All right. So next speaker is 8014. 8014. This is your time to talk. #8014, *6 to unmute yourself, please. #8014, are you there? *6 to unmute yourself. We can put you back in the queue. Oh, there you go.
Okay, can you hear me?
Yep, you're on.
Okay. Hi, my name is Nicole Young. I'm asking you to please stand up for the people of this county by not putting a vaccine mandate in place. I know there's a lot of questions about transmission, but according to CDC Director Walensky, being vaccinated does not stop transmission. At best, it just helps you have less symptoms. Mandating the vaccine won't stop COVID, but it will hurt the people of this county even more than they already have been. I've been working throughout the pandemic. I've seen a lot of people lose their jobs, lose their livelihoods. If you force a vaccine mandate, even more people will have to choose between the health of their body and whether they want to keep their job. It doesn't matter what the federal government or the state government does. I know other people have raised that question, but as the County Board of Supervisors, you are the lesser magistrates. You have the ability to interpose yourselves between us and higher levels of government to protect the constitutional rights of our people. And I would just like to ask you to bear that in mind. Thank you.
All right, thank you for that. And next comment comes from 7488. 7488. You can press *6 and begin talking. All right, 7488, *6. Give you another couple seconds here, and then we'll put you back in the queue and jump into someone else. 7488. All right, we are going to put you back in the queue, and we're going to do 7454. This is your time to speak, 7454. Can you please unmute yourself, *6?
Ken Sawatsky, of course, I take what your employees say seriously. I don't quite understand why, with a consensus amongst all your department heads to stay with the number one option there, why we even had this meeting. I appreciate public input and public participation, but I think it was unanimous there, and I think that should have been sufficient to avoid having this particular meeting. Down in Mexico, I can bring it back here. The possibility of quick tests, and I was going to give you the company name, but I can't find my receipt. It's roughly $25 in 25 minutes. You have the result to fly on the international airplanes. So somehow that's doable. But my understanding is on November 1st, possibly the state will change their particular guidelines. I'd stay with whatever the state government has as far as guidelines. As far as employees out there, don't quit. If your concerns aren't addressed, and they fire you, of course, somebody mentioned before, that's a wrongful termination lawsuit. To avoid that, to avoid litigation, don't stray, don't vary from whatever the state mandates are, either up or down, and let them be the test case. Why should Humboldt County be the tip of the spear regarding people's rights on this litigation? So I just can't quite understand why exactly we're having this with unanimous input from your county department heads. I have spoken to other people out and about, and I think let's just put it this way. It's not broken, don't fix it. I think that's a pretty good philosophy to follow. That's coming from the recommendation of your department heads. Thank you for my opportunity to reiterate what they said earlier.
Okay, thank you, 7454. Now we're going to move on to 7488 one more time. 7488, are you there? All right. We can.
Hi.
You're there. We can hear you.
Okay, great. Hi. Thank you. I'm a local mother and educator. I have no political affiliation. While science continues to show that vaccination neither stops spread or infection of COVID-19, I really just want to comment on the basic human right to choose what goes into one's body. Any form of vaccine or testing mandate is absolutely a human rights violation and also a violation on several points of the Nuremberg Code, of which you have been well notified. Denying people access to society based on their private medical decisions is absolutely wrong, bottom line. With that said, I would encourage you all to visit HumboldtFC.com, that is the Humboldt Freedom Coalition, where there's a growing collection of science-based information, studies, articles demonstrating clearly that these COVID-19 injections are neither safe nor effective. Also that the PCR test is not accurate. It is your job as our elected officials to do your due diligence, and you have been well notified of the Nuremberg Code and also of a plethora of resources available to you to support our point here. But again, truly, bottom line, my body, my choice. I have several friends in the medical field who have experienced severe reactions to these injections, which will affect them for the rest of their lives. And the only reason they took the injection, despite having worked in the medical field throughout this quote unquote pandemic, the only reason they took it is because they were coerced to do so by their employers. Please do not mandate these injections or tests on anyone. We know that you are being paid to push this agenda. It is clearly a financial and political agenda. Vaccines make billions for the rich. Healthy living and early treatment are not profitable. Please choose to be on the right side of history. Thank you.
All right, next on this, we have commenter 1052. 1052, press *6 to unmute, please.
Hello, can you hear me?
We can hear you loud and clear.
Hi, my name is Rebecca, and I am very concerned about the vaccine and the adverse events, and that's the reason that I don't think it should be mandated. And I know people have been talking a lot about VAERS, and so I thought I would share the actual written report of VAERS. There are a few I will read out loud with the VAERS ID cases. I chose some reports that are from adults 40 to 49 years of age with the Pfizer-BioNTech injection, which is still under emergency use authorization here in America, even though one has been approved, but it isn't being used here. So, although I think it's still dangerous. So the VAERS ID number is what I'll read first, and then I'll just go ahead and read the report, and you can just make your own judgment. These aren't necessarily all verified, but I'm just going to read them anyway. They're things people reported. So number 1256112. My husband received the shot on the 22nd. He died in his sleep on the 24th. He was complaining how the second shot really was giving him a lot of trouble, but nothing that would indicate life-threatening symptoms. Number 126487. Cough and diarrhea the day after receiving vaccine. The next day had difficulty breathing and collapsed. Number 1278349. Patient suffered a seizure and pulmonary edema 4 days after receiving second Pfizer shot. He was pronounced dead several hours later. Patient had no health issues and was 45 years old. Okay, let me see, I'm getting down here. I have some chosen. Okay, 1330411. Within 12 to 24 hours, patient noted to have altered mental status. Transferred to ICU, where it was later discovered that the patient had an intracranial hemorrhage, so a brain bleed. Okay, 1330552, blood clot in brain causing stroke, then death. Number 1350670, At first dose, her mental status became slightly altered and she leaned to the left a bit when standing up and walking. From the day of second dose, my sister's appetite decreased. She started sleeping more, got weaker to the point I had to bathe her. She had to start using a wheelchair. Mental status much more altered. She was too weak to go to the dialysis on Monday, March 22nd, 2021. Hospice was called in Tuesday, March 23rd, and she passed away at approximately 4 p.m. March 24th. Okay. Next is...
You're getting close to 3 minutes here.
Okay. Thank you. Anyway, you can see the idea. There are so many of these, so many, and all different age groups. So with the city council meeting I spoke, and my son, who's 11, was surprised. He said, wow, there were so many good points made. And then the city council members just unanimously voted to, promote the vaccine mandate. And there were so many good things said. He stated that about 5 times that night and the next day.
So you're past 3 minutes now.
So I appreciate you listening to us. Thank you.
All right, thank you. All right, I apologize for having.
Supervisor Wilson, you're on mute.
Oh, sorry about that. Thank you. I apologize for the for having to, cut in when people are over their 3 minutes. We're just trying to kind of make it so everyone has the equal access here. So we have public member 1075. 1075. Please press *6. Looks like you're unmuted. 1075.
Yes, I'm going to complete my time statement. Just so you know, I did time this. It is within 3 minutes, so please don't cut me off this time. Thank you. My name is Christina Gerst. I am a retired utility worker and certified technical instructor. My question is this. Is the board at all concerned with the trend in litigation that is taking...
We listened to this already, so I really don't think we have to listen to this again. So I appreciate that. We're going to move on to public member 0072. 0072. Please unmute yourself. *6 to unmute yourself and enter into the conversation.
Hello, can you hear me?
We can hear you loud and clear.
Very nice. So I think it's clear everyone so far's position. But what I really wanted to drive home is when Cal OSHA comes back in a month and forces our insurance policies to cancel because we're not vaccinated or we're not in compliance, how are we going to deal with that? Because that's really the issue. Even if we don't do the mandates now, they're going to come back at us in 3 weeks to a month, like Ian said, and they're going to be, they're going to force us by losing insurance into coercion. So how do we plan to deal with those losses? That's really the elephant in the room, in my opinion. And I appreciate everyone, Hansel and Bushnell and all the Rex and all of you guys are just amazing leaders. You're doing the right thing. We have your back. God bless you. That's all I wanted to say.
All right, great. Thank you for that. Public comment 0326. 0326. This is your time to speak.
I have a. This is Charles Wilson. My wife wanted to also make some comments after I do my comments, but she's got separate things there. I've been a licensed civil and sanitary engineer for 60 years. I worked for government for 30 years. When this mandate is an insult to my intelligence and to my freedom, I would let the government fire me and I would lose my retirement if they tried to do that to me. I tried to get an answer out of the health department of what their definition of experimental was. I went to I'm the guy that the health department almost pepper sprayed. Now the thing is, here I get insulted by that health department employee. He comes back and he pushes me with his stomach to start yelling at me to get out of the public area. And here you had Stevens and Hoffman listen to it. Okay, now neither one addressed the idea of what experimental was defined as. Stevens said, it's been studied for 20 years. They've been studying vaccines for hundreds of years. What that means, that doesn't mean anything about my question was the National Institutes of Health said that if a vaccine had not been approved by FDA, it was experimental. Then she said it was not experimental. Then Hoffman didn't talk about it either. It's not experimental. Neither one gave any, apparently condoned the idea that I was almost being pepper sprayed and that they were not going to be answering my question in any way. Hoffman says we need education. We've had almost 2 years of education now. And all I've learned from Hoffman and Stevens is that if they do not want to listen to what I say, they will use force to force me to shut up. Now, I'm tired of this kind of nonsense out of government. Here we have the culture, the media and the government is culturing a hate on the unvaccinated. My wife had somebody said, I hope you die before you infect me. Somebody threw a rock at us. One woman said, I wish I could run over all of you. Another said, when you go in the North Coast Journal 2 weeks ago, said the unvaccinated should not be allowed to be in the hospital.
Sir, you're at 3 minutes. Can you summarize?
Okay, you don't have the bell anymore. Here, I'll give you to my wife. Just a second.
Okay, thank you for my opportunity. I'm Genevieve, and my point is, this whole thing we all heard about the vaccine injury and everything else, but it's all boiled down to freedom to choose and tyranny. But my point is, I'm not going to take it. People down the street 2 months cannot walk after the injection. Another person, her husband just died because he was a healthy person. He went to the hospital. They gave him a ventilator and he's dead. And then 2-3 houses down her place, a woman got vaccinated. And 3 days after that, she had a heart attack and have an open heart surgery. This all happened in front of us. And all your supervisor, government people, you heard that. And somebody say, oh, coercion, because you're going to lose your job and more people will get vaccinated. Why? Because people going to have food to eat, to feed their children, a house to live, and then they coerce them to get the shot. I told people, please don't take it. First, you will lose your immunity. Second, you might be disabled. Third, you might die. You still don't have ability to feed your family. Brother, please keep your health, freedom of choice. Unvaccinated didn't cause any problem for vaccinated people. Please, don't spread that kind of rumor and don't have hate. Hate is destroying people, and mask is very detrimental to health. Because you have red blood cell, you need oxygen. Oxygen helps the red blood cell to make your T cell. If a T cell doesn't get produced, you don't have immunity. That's why you get people sick. Right now, 80,000 or 800,000 children get sick. Who gave it to them? The parent got the vaccine because of government lied to people. It's not a vaccine. It's a biological agent. And this is all genocide. If everybody still decides to mandate, and you're all the government official, you have conscience in your life. You don't want to be part of the genocide. Come down to the history. Please, no mandate. Even right now, Congress already decided. So that's the thing. I won't want to fly either. Car pilot have a heart attack or stroke. You might be cremated up there. Get it? This is body to the, I know it's a very touchy situation. We have conscience. We love people. Please, love and freedom will prevail. Love and freedom, love and freedom. Everyone desire hate and tyranny, everyone despise. Heavenly love, we'll be back in time with all the people with the conscience in health. Thank you.
All right. Thank you for that. We are on to the next public commenter. We have about, right now, about 6 public commenters that are left in the queue currently. So if you're thinking about making public comment, you might want to be thinking about raising your hand fairly soon if you haven't done already. So we're at 8844, number ending in 88444. Please press *6 and we'll get you lined up for speaking here. So 8844, please press *6. That's your number ending in 8844. Anybody there? I have not seen you *6ing yet. Give it another second or two here. And so we're gonna move to public. Oh, there you are. 8844. You're great. And just so you know, the next one after this is gonna be 0150. So when 8844 is done, 0150, please get ready to.
Yeah, can you hear me for 8844?
Can hear you great. Mm-hmm.
Yeah. Oh boy, I had to run in here. Hold on. Am I ready to go?
You're ready to rock.
Yeah, this is Perry Bressman. You know, I want to say for the people who want their freedom and everything, that's fine. But when it's time to get on a ventilator, allow the people who have a vaccination card, please let them go first. We have scientists and doctors who've spent decades and their lifetime helping us avert all these viruses such as chicken pox and all of these things that has shown that things work. So I hope that the supervisors choose to do something along that line. If people are wanting to leave the positions, so be it. Hire people around here who want to work. It'll keep people retained in our area anyway. 911 calls are going daily of people being hospitalized. 120 people testing positive over the weekend. What's wrong with people? We're being held hostage for the people who choose not to get vaccinated. And if they want to choose to not get vaccinated, fine. Just remember that you're keeping the herd immunity from working. This is the only way out of this, is for people to get vaccinated, for crying out loud. I'm surprised that only half of the deputies in this area have been vaccinated. Of all people who should be vaccinated, it's our fellow deputies. It was on the news this morning. More deputies in California are dying than anywhere else in the United States, amongst a few other states. But we have one of the highest cases of COVID going on because of people not vaccinated in Humboldt County. We got the highest meth, the highest gas prices, the highest COVID rates. Let's do something right, and please support mandated vaccinations within
you're on 3 minutes.
The county. Yeah, thank you. I appreciate it. I'll close for now.
Okay. Well, great. Thanks for those comments, and we'll move on to the next person. So the next one is 0150. If you could, 0150. Can we unmute or elevate 0150? Let's see here. And Tracy, there we go. Got it. Okay, 0150, you're unmuted.
Hi. Okay. So I just want to say that as a Christian Scientist, all of my life, I'm 72, all of my life I've had an exemption, a medical exemption. I went to a private school. I was exempt from even taking a science class. Whether anybody believes that's a good idea or not, that's okay. But that's what my mother believed in. I was very healthy most of my life. Things have gone well for me, I'm glad to say. And I still took the vaccine because people were really worried about me being around them, and I wanted to respect them. But that doesn't mean it was the right choice for me. It doesn't mean that it was the right thing for me. It doesn't mean it was the right thing for my body. But I did it because I was being pressured. I don't think people should be pressured to do something like this. I think it should be an individual choice that people can live with and care about and feel good about. So we need to take a stand here in Humboldt County and in California to make sure that people really can have the exemptions that they need. There are big mistakes that are being made with people that take medicine that shouldn't be taking medicine. Right now, my daughter, who's in her 40s, is stuck in Australia because she can't come back. She's immune compromised. She has some health issues, and they're all saying, do not get vaccinated. Every doctor in Australia is saying, you will die if you get vaccinated. For me, as a Christian Scientist, I don't want to get vaccinated again and again and again. So why aren't we making this a choice? Why aren't we making this fair for everybody to do what they think is right? My husband had open heart surgery, and he wasn't getting better after it. We just went to the cardiologist, and the cardiologist just said, get off this medicine, it's making you worse. Sometimes there are mistakes. Sometimes there's bodies that just don't respond to medicine. And sometimes people want to pray about it and know that God is their support system. So I think my phone is, am I still on?
You're still on. You got, less than a minute
okay.
here.
Okay. So please, let's really be careful and conscientious. And as far as the people getting vaccinated, what's the deal with the kids being vaccinated? They can't go to school, so you're going to have them at home. I mean, that's just absurd. If you have them at home because their parents had to get vaccinated and whatever, and then the kids are at home, they can't go to school, then who's going to take care of the kids? Somebody else that's not vaccinated. So why don't you just let people do the right thing and take care of their bodies and do the zinc or vitamin D, whatever? A lot of people in Humboldt County have had COVID. And if they test, they will find that their antibodies are right there already for them, which is way better than any Pfizer.
All right, you're at 3 minutes now.
Yeah, thank you.
All right, thanks. All right, so next we have commenter 9808. It's commenter 9808. And again, it's 3 minutes. I'm thankful for everyone's doing their best to keep to 3 minutes. I really appreciate that very much. 9808.
Hi, my name is Samantha, and I'm a mother and community member here in Humboldt, and I really appreciate everyone speaking up and taking the time to talk about this issue, and it makes me just happy to know that there's other people that want to stand up against these mandates. It seems like the main point that the general public is that by being vaccinated, you are looking out for the safety of the whole community. And it's not just about our personal freedoms, it's about looking out for others. But by looking at Israel and the studies that have come out of there with their population nearly being fully vaccinated, they have reported that this vaccine is only 39% effective, which we used to be told that it was 95% effective. So we can't believe those statistics, and it's been an experiment because it hasn't had any long-term safety data. We are essentially the experiment by rolling out this emergency vaccine. So that argument is not valid because people are still spreading COVID, people are still dying of it. that are vaccinated. And the other point that I want to make with that is that you aren't considered fully vaccinated until 2 weeks after your second dose. You have to wait 3 weeks for the Pfizer in between the first and second dose, up to 6 weeks. So that means there can be people that are getting sick with COVID, being hospitalized within that time frame up until that 2 weeks post second shot that are being written down as unvaccinated when in fact they've had their vaccine, and we aren't reporting that. We should be reporting these things like every person if they've had a shot, and not just waiting till that 2 week post second shot, because that's not accurate data. And then the other thing that I'm hearing is that people are worried about the Cal OSHA taking away insurance, but personally, I just think if that's what you're worried about, that clearly doesn't mean you're worried about public health. You are more worried about financial loss. And we're also not talking about conflict of interest of the people that are mandating these, the doctors, if they're being paid off by these companies to promote these vaccines without actually looking at the data. My uncle received the Madrone vaccine in the spring, and he directly after went to the hospital for heart issues. He was in the hospital for a month and died of a heart aneurysm, and they didn't report that. No one's reporting.
You're at 3 minutes. If you could summarize,
okay,
that'd be great.
No, that's great. Thank you.
All right, good enough. Moving on to public commenter 2267. 2267. Can you jump in there? 2267. 2267. Press *6 to unmute yourself. Two, 267, are you there? And staff, I have also in the queue here 2048, but didn't 2048 already speak? And 2048, if you can unmute yourself and let me know if you've already spoken. With the number ending in 2048. 2048 or 2267, can either one of you? Okay, 2048.
Hello?
Hello, did you already speak or are you waiting to talk?
I'm a fifth generation Humboldt County local. I've been here my entire life, born and raised in Garberville. And I just wanted to say that I want to give a shout out to our sheriff, Billy Hansel, for bringing up some really great questions and standing up for our community's freedom. I really appreciate that our sheriff's department is not only protecting our community against crime, but also against the crimes of our freedoms being taken away. Thank you, Sheriff Billy Hansel. I back the blue. And Dr. Ian Hoffman is a liar, and we should not trust him. Thank you.
All right. Thank you. If we could keep the disparaging comments less personal, that would be great. So, but it is your freedom to speak your mind. It's just, try and keep the tone as friendly as possible. Let's see here. Public commenter 2267. 2267, please unmute yourself. Thank you. Okay, we got you, so you can talk now.
Hello. Thank
Hello.
you very much. Hello, my name is Effie Boudreau. And I just want to first of all say thank you for this opportunity and providing the space for public comment. I'd also like to echo what the previous lady said and thank our Sheriff's Department, Sheriff Hansel, and our Supervisor Bushnell and the rest of the supervisors that are supporting our freedoms to choose what is right for ourselves. I really do appreciate that, and I think it's really important. I am a mother of 3 kids. I'm a property owner in Shelter Cove. I own 2 businesses in Shelter Cove, the studio Lost Coast and also Lost Coast Wellness. We are both wellness businesses, and we see patients individually. And I have to say that there are a lot of people that have gotten the vaccine that have had adverse effects in our community, and they are not reporting it. and they are dealing with it. And it is very, very concerning. The more concerning thing to me is to learn on this call that we will be dealing with this through an OSHA situation. And so I'm just wondering, what does that look like? That's really concerning because all of the cost factors that go into that, and again, the elimination of freedom of choice for your health is very concerning. That's all I'm going to say. And I just really appreciate having this opportunity to talk because I'm concerned as a mother of 3 children and as a business owner and as a resident of Humboldt. So I think we need to be really diligent as a community to provide the best health situation that we can. And we need to focus on some prevention, and we need to focus on some therapeutics that really work, not experimental things. Thank you very much.
All right. Thank you for that comment. Next public commenter, and again, we have 4. After we're done with public comment, we're going to take a break because we've been at this for a long time, and some of us probably need to take a bio break and some other things. So next commenter is 2632. 2632. You can press *6 and jump in.
Hello.
Hello. 2632. You're up.
Yes. My name is James Keithley. I'm totally against this medical tyranny myself. Natural immunity is by far better than the jab. The jab reduces the immune system by 35%. It's been proven. The second jab reduces it about 60%. It's not even a vaccine. It's gene therapy. The masks, they're causing bacterial pneumonia. The O2 levels, they're highly reduced, and the breathing is very bad. I mean, psychologically for kids or anything else. I mean, kids that are born when they're barely babies, up to 3 and 4 years old, the mouth, which you're covering with the mask, is they need these expressions and facial expressions to be able to learn and so forth. Another point I was going to make was, I mean, let me see here. What was I going to say? Well, the vaccine alone has killed more people than all vaccines, polio, measles, mumps, all these vaccines. It's killed more people than all the vaccines together. I mean, it makes no sense. I mean, it's your body. The Nuremberg Code says exactly. I mean, you can't put this under your body. We've already been through this with the Nuremberg Code. They say that the vaccine was made from a human, from the 60s, from a baby. A whistleblower from Pfizer came out and proved that through the emails. And as you go to Israel, which is 97% vaccinated, and everybody's getting the COVID variant 3. The people that are vaccinated are the people that are getting the COVID variant D. It's I don't know how you call it, but it's where it leaches. It comes out of the body. And these are the things I'm concerned about. And I feel that, natural immunity is way better than anything. Let your body deal with it. I mean, I've had it and and it wasn't nothing. I mean, 2 days I felt a little bit slow, groggy, but it was nothing for me. I mean, but that's all I want to say. And I thank you for your time. God bless America. God bless Humboldt County. And last thing, and peace, Joe Biden. God bless us all.
Okay. Next, we have public comment 7607. 7607, you are ready to speak. Press *6 and we'll get you started. You're ready.
Hi, this is Diane. Hi, can you hear me?
Can hear
I
you
hate when people say that. Okay, this is Diane Edwards. I'm a civil engineer. I am not a doctor. I went to school to be a civil engineer. If you want me to design a road, I can. If you ask me anything medical, I can't tell you. I trust doctors. Doctors who went to school for many, many years, far more years than I did, they are saying get vaccinated. Everybody should be getting vaccinated. We as a society have this huge problem. It's destroying our country. It's destroying our economy. And the only way out of it is for us to all work together to try to solve this problem. The doctors are saying get vaccinated. Everybody should get vaccinated. I've been vaccinated. I had no ill effects. I see that people are opposed to being mandated. And I'm sorry, but the government has got to take the lead and try and get us all together, working together in the same direction. A lot of people are getting their information that they're calling factual information. They get it from social media. These social media companies like Facebook and TikTok and whatever, they give you what you click on the most. If it makes you angry, you tend to click on it more. The algorithms that run these computers that put stuff in front of you are giving you more of what you continue to click on. And so there's a whole lot of false information being promulgated by social media. I don't go to social media to get medical advice. I go to the doctor. The doctors say get vaccinated. Dr. Pardo was part of a medical team who saved my life in 2002. He was on the City of Eureka board meeting recently saying, please, everybody, please get vaccinated. We have to look out for each other. We have to take care of the children who are under 12 who can't get vaccinated. We have to take care of the people within our population who have autoimmune disorders and are susceptible and they can't get vaccinated. The rest of us have all got to work together to try to protect all of us as a society. The benefits to society far outweigh the rights of the individuals. And as a society, we need to work together and we all need to get vaccinated. I appreciate you, Board of Supervisors. I listen to you every week. You're all my friends. I rarely ever call in. Please do the right thing. Please do whatever you can to try to enforce everybody getting vaccinated. Sheriff Hansel, 59 officers have died in the state of California from not being vaccinated from COVID. And COVID is now the #1 leading cause of death of police officers and peace officers throughout the country. It is exceeding the rate of death due to gunshot and car accident combined. COVID is now killing more officers than anything else. Please do whatever you possibly can to try. I don't understand option 1, option 2, option 3. Please pick the
We're getting
option
close to 3 minutes there.
that gets everybody vaccinated. Thank you. That's all I have. Thank you.
All right, thank you. Again, I'm trying to keep it tight as we can in terms of time. So next we have commenter 1282. 1282.
Good morning, Humboldt County Board of Supervisors. My name is Johanna Johnson. My beautiful 13-year-old grandson almost died from a vaccine injury. He was injected with Gardasil for HPV, human papillomavirus. He became ill, experiencing intense pain and numbness in his limbs. He was admitted to St. Joseph's in Eureka, then airlifted to Oakland Children's Hospital. He underwent many tests, including a spinal tap. He was treated with IV immune globulin. He became paralyzed from the waist down. He was unable to lift his arms above shoulder height. He lost 30 pounds and lost interest in eating. He was dying. Our family decided to bring him home, and over time, he gradually hobbled up on crutches, then began to walk, then he was able to finally run. Miraculously, my grandson pulled through, unlike tens of thousands of children who are permanently crippled from Gardasil, the HPV vaccine. All vaccines have a risk factor. All vaccines can cause death, permanent disability, and serious injury. There's the Vaccine Adverse Event Reporting System, a federal database. VAERS lists over 15,000 deaths due to the COVID-19 vaccines. Dr. David Kessler, former director of the FDA, states only about 1% of serious adverse vaccine events are reported. Just add 2 zeros onto the 15,000 COVID deaths from vaccines. Also, Biden trying to force mandates through OSHA. 24 attorney generals from 24 states wrote Biden a formal letter opposing trying to mandate through OSHA, also calling out Biden that is illegal for him to try to do that. The pharmaceutical companies have zero liability with these vaccines. Wherever there's risk, there needs to be choice. Thank you very much.
Okay, thank you. We have 2 more public commenters left in the queue. So I'll give it another, after the end of this next public commenter, if you don't have your hand up, we'll basically move on to the break. So with that, public comment 3053, if you could unmute yourself, *6, please.
Hello, Tom Smolder, confirming you can hear me.
We can hear you loud and clear, Tom. Miss.
Okay. So I am pro-choice. I think it's very, very important that you don't try to mandate your employees. I believe county staff, there's multiple reports of staffing shortages as there is already. And if you impose these mandates, you may continue to have more shortages. I don't feel it's the appropriate thing to do to anyone. Everyone's entitled to their choice. This is the United States of America, freedom of choice, life, liberty. Some people argue that people that aren't vaccinated are selfish, but I think you need to look at the whole picture and think about what we are as a rural county. People like to live by choice, and there's a lot of risk. There was a comment earlier that had a lot of really good facts. There's risks involved with mandates, and it's still, everyone should be able to do what they feel is appropriate for their own body. And I don't feel with staffing shortages the way they are, it would be intelligent of Humboldt County to impose mandates on employees. Thank you for the opportunity to speak.
Sorry about that, the mute button. Up next is speaker number 1530. 1530 is promoter speak. So 1530, and then we'll have 2 more after that, which is 3406 and 3204, and we will be ending it after that. Oh, I got 1 more. 5095 will also be in the queue. So I'm going to hold the line at that one. All right. Here we go. Speaker 1530.
Yes, hello. My name is Ashley Linhart. I'd like to start out by first stating that my rights do not end where any of your fears begin. I'm speaking today against any mandate proposal for vaccines because it is a huge overreach against any person's individual choice as to how they care for their bodies. None of us should be enforced to any so-called mitigation. I'd like to point out what should be obvious to all elected officials at this point in history. To force or coerce any medical intervention is unethical, unlawful, and it is tyrannical behavior. It is against our constitutional rights as Americans. These COVID mRNA injections skipped animal trials, and the population is being experimented on. In case you are unaware, these human trials are ongoing until 2023. Furthermore, the PCR test is not FDA approved and has been shown to be extremely inaccurate. It is also illegal to mandate genetic testing as a condition of employment. The PCR test is by definition a genetic test. Next, I'm going to read part of the Nuremberg Code. Although I know you've heard about this many times today, I think that it is worth reading again. Point 1 of the Nuremberg Code states, the voluntary consent of the human subject is absolutely essential. This means that the person involved should have legal capacity to give consent, should be situated as to be able to exercise free power of choice without intervention of any element of force, fraud, deceit, duress, overreaching, or other ulterior form of constraint or coercion. I'll end that quote. If you choose to mandate this experimental injection as a condition of any employment, you are blatantly in violation and overreaching and removing a person's ability to exercise free power of choice. No one should have to choose between making an honest living or being coerced into taking an experimental injection that has mounting evidence of possible adverse reactions, including death. As a reminder, an overwhelming majority of Humboldt citizens are not a vulnerable population. They have a 0.00 chance of death from COVID, and this is based on county statistics. With that being said, 45% of the population in Humboldt County have chosen not to receive the mRNA injection. This is 45% of our community, and they are our neighbors, our friends, our family. Some of them are our city and county employees. This is 45% of the population who will not have an equal opportunity to apply to city or county positions. This is medical discrimination. I implore each one of you to put your personal fears and preconceived notions aside and make an ethical, unbiased choice by stopping this authoritative behavior now. For every choice or for every voice you hear in opposition today, there are hundreds more that do not consent to these mandates in any way, shape, or form. I'm putting each one of you on notice. If you vote yes, we the people will begin efforts to recall you. Ian Hoffman, you are spreading blatant lies and propaganda. We the people will find a way to remove you from your position. You are on notice. Thank you. I yield my time.
All right, next we have commenter 3406. 3406. You're ready to speak. Please, there you go. We can, you're unmuted.
Hello. I'm getting in. Are we in? Yeah. Go ahead. Okay. I'm Linda Casera, a woman on the land, commonly known as Humboldt County, California State Republic. And Confucius once said, when words lose their meanings, people lose their freedom. You didn't do it? Okay. So here's the definition of mandate. Mandates were the instructions which the emperor addressed to public functionaries, which were to serve as rules for their conduct. These mandates resembled those of the proconsuls, the mandate jurisdiction, and were ordinarily binding on the legates or lieutenants of the emperor of the imperial provinces. And there they have the authority of the principal edicts. My point is, yeah, if we don't have definitions of words, we're not communicating. I mean, it's like, no, it's like ordinance. That's something that you give to the people that work, they're corporate employees.
All right, I'm going to speak. My name is Deanna Hardwick. I've been a small business owner in Eureka, California for 26 years. Last summer, I called and demanded a request for you vote to end the state of emergency. Public officer used Health Code 101080 to say in case of a spill, that's how they got masks on all our kids here. They are violating the Brown Act. They're using executive orders. Mandates and orders are not legislative code. This board remains in closed session for 19 months, a clear violation of the Brown Act. You're citing OSHA, CDC, any other organization will not help when the lawsuits start flying in on the mom and pops here and all the businesses. We do not have mandates or order suits, we have lawsuits. These six board of supervisors, Eureka City Councils, police officers, and sheriffs who did not follow the Constitution here. I was arrested in November for not wearing a mask. If you don't think they'll haul us all off to FEMA camps by orders and mandates, you need to understand these people think they have all this power here. Justice will be served on every criminal in Humboldt County, and it will be based on legislative code without orders. After today, it will be obvious to all if you are going to remain ignorant against your constituents and ignore us, you are all sellouts. Thank you.
Supervisor Wilson, your mute button's still pressed.
Sorry about that. Next public comment is 3204. And we have two more after that, and we will move into lunchtime or break.
Hi, can you hear me?
Yes, we can hear you.
Okay, hi. I started my own timer, so hopefully I can stick to it. My name is Stephen Casso, and I am a county employee. I hope that's okay for me to make a public comment on this. I'm a 29-year resident of Humboldt County. I have raised 4 children here, and I'm calling in very much in favor of option 1 to require vaccinations of all county employees. bear in mind, we're not talking about children. We're talking about adults. And I have very selfish reasons for wanting these mandates in place. I want to protect my youngest children who are unable to be vaccinated, and my aged parents who are vaccinated but are susceptible. I think it's unfortunate that certain factions in this country have chosen to politicize this debate and this issue, starting at the very beginning with, the former president of the United States. And it's trickled down and has become a very charged political issue for many, many people. I know that not everyone on this call that's predominantly called in are doing it because of politics or influenced by politics. There's a lot of anti-vaccination sentiment as well. As we know, many vaccines are mandated for children to attend school. I don't see this as any different, except that we are facing a global pandemic. It's an emergency situation, so emergency authorization is appropriate. I should point out also that at least the Pfizer vaccine is now FDA approved, and that the best way to protect yourself is by being vaccinated. The rates are coming down, death rates are dropping. There's correlations to requirements being put in place. I agree with some of the callers who say do the right thing, and the right thing to do is to follow the science and follow the medical advice you've probably been given to get vaccinated. My heart goes out to all people who experience trauma, death, and disfigurement or whatever from a vaccine. These are very low number of cases. It's relatively infrequent. And I also want to point out that there is an incredible amount of misinformation out there, and much of it is motivated politically. So I urge people to get vaccinated. I urge you to listen to your doctor. And thank you for giving me the time today.
Thank you for that. That was 3 minutes on the dot. Okay, so we're at the last two commenters right now. So 2223, if you could jump in. And so this is your chance to speak.
Good afternoon. Can you hear me?
Yes.
Good afternoon. This is Craig Johnson, longtime Humboldt County resident.
Hold on, Craig, one second. Craig, 1 second. Did you talk, or did you talk at the public comment before? Is that where you talked before, or have you talked?
I did. I spoke as public comment prior to, because I couldn't find this agenda anywhere, and I didn't feel we could even continue because I don't feel enough of the public was made aware of this.
Okay, I appreciate that. I just want to make sure. I got just momentarily confused recognizing the name. So go ahead, restart. I apologize for that.
Sounds good. And since you asked me a question, I have a question for you. You were going to ask counsel if my point was valid at the beginning, and we never talked to counsel about that.
Okay. Do you want to take? You're on your 3 minutes right now. So.
Oh, okay. Well, I'll start my comment for this particular. We seem to having it back and forth, so I can continue with that. Yes, this is Craig Johnson, longtime Humboldt County resident. I am against mandates. They are hurting the working people of Humboldt County. I can speak from personal experience that my wife had to give up her job at a local college due to these mandates coming down the line. And I could say what we think is a minor mandate today becomes major tomorrow. I think some of the other callers spoke to that more and more is going to be thrown at us. It's hard to go the other direction to pull back and give our freedoms back to us as we lose them so quickly. And I'm going to leave you all with one last thing. I heard one of the departments had talk about $150 cost, or $150 cost or benefit. we should offer a benefit, and that benefit should be to a credit at their local farmers markets that would bring up overall community health and help the local farmers of Humboldt County provide more food moving into the future as we go into these new phases of our society and existence. Thank you, and I am against mandates.
All right, thank you very much for that. And so we got one last commenter, that's 5095. This is your time to talk.
Hello, can you hear me?
I can hear you.
Hi, I am a county employee and I'm calling in response to this issue here. I'm totally for this mandate. We as county employees take an oath to protect the community that we serve, and it's part of our FEMA duty to be taking care of our community when we are called to do so. And I feel like this issue of vaccination is really important. And I hear all of the fear about, you know, the slippery slope of issues regarding body autonomy. I don't really think that a vaccine mandate would force anybody to do anything they didn't want to do. It just enforces a consequence for not doing what's laid out for the greater good of the community. So that's a choice. You know, if you did choose to do a mandate and a county employee didn't want to get the vaccine, that's fine. They just might not have a job. So I urge anybody who is afraid of this vaccine or, you know, feeling like they're being coerced to get vaccinated to really think about why there's so much pressure for this. It's like, in the context of public service, we're here to help and to serve our community. You know, and if you choose not to protect others by refusing to get a vaccine, do you really belong in a position of public service? You know, you would have a great potential to harm others if people don't get their vaccine. We're about to head into flu season, and I mean, who knows? It could it could get worse. It could get better. You know, we don't know. But I think that it would be wise to require vaccines for public servants. I think it's an overall good thing for the community, especially working in a public building. You know, I've been vaccinated. I would hope that other people that I work with can see the value in wanting to protect the other people that they work with by, you know, making sure that they have done everything they can do. You know, it's not to say the vaccine's infallible, but it is something you can do to try and help the situation of this pandemic. I value logic and utility meaning the greatest benefit for the most amount of people possible. Unfortunately, this pandemic has been politicized, and people think it means something to follow a political party line. Misinformation and illogical beliefs and acts are only prolonging the time it will take to get ahead of this virus. I hope people can suck it up and choose science and care for the community to break their fear of getting the vaccine. And if they can't, they don't have to. They just might suffer a consequence of not having a job. And I think that that's a choice.
We're at about 3 minutes there.
All right, I'm all set. Thanks.
All right, thanks for that. All right, so
Supervisor Wilson, you hit your mute button.
I keep doing that. So I appreciate you staying on me with that. I really do. I have one more public comment on here. I'm going to let this one under the wire because it's only one, but it is absolutely the last one. So public 0069, you have 3 minutes to have the last comment of the day with relationship to this subject. 0069, are you there?
Good morning. Can you hear me?
We can hear you.
Wonderful. This is Melanie Johnson. I'm a Humboldt County resident, small business owner, landowner, and a homeowner. In late July, I contracted COVID from a fully vaccinated person. Our symptoms and the duration of the virus and the illness were equivalent to each other. I know dozens of people who are fully vaccinated who have contracted COVID, whose symptoms were more severe, and the duration of their illness was much more severe than mine. I also know dozens of people who were sicker with the actual COVID shot than I was with the actual virus. Despite testing positive, and this is documented with Humboldt County's Department of Public Health, I lost my lecturer position at our local community college for refusing a shot. I already had COVID. I survived COVID, and I lost my job because I wouldn't get a shot for something that I already had. I think that we really need to give the same sort of energy around these vaccine mandates, around those of us who have occurred natural immunity. And I understand that there's misinformation on both sides, but the CDC's own VAERS website is not misinformation. That's the CDC's own website. And I think that when you're looking for information and you're counting on the CDC for advice on how to move forward, looking at their own website that documents adverse effects from a vaccine is relevant. So I would really believe as a community, we need to give that same sort of energy around these mandates, around those of us who have occurred natural immunity, and the serious consequences that it's been on my family and it's going to be on our local economy when more of us who have survived COVID are going to be losing our jobs and have already lost our jobs because we're not willing to take a shot for something that we already had. Thank you.
All right, that's it for public comment. It's 12:07. We've been at this for a good 3 hours, pretty straight. It's time probably to take a break, I think. I'm gonna say we're gonna come back at 1 p.m. and we'll do this at 1 p.m. So we'll come back at 1 p.m. We'll let everyone take a break and or do some other things they need to do, and we'll re-adjourn at 1 to continue this. Present for this. All right. Thanks, guys. Appreciate it. Just want to know I'm not floating alone here in virtual space. All right. So we're going to jump back in. We've had some comments and questions. We had some staff reports, and then we went through public comment. And so I think right now I want to ask if Director Hoffman and, or excuse me, Public Health Officer Hoffman and Linda Lee, Director Linda Lee, if you guys have any comments or things you want to address with relationship to the public comment that we've received. And I'll start with you, Mr. Hoffman.
Thank you, Supervisor Wilson. Yeah, I think, we heard a lot of things from both sides of this debate. Just reiterate a lot of the things that I've said throughout the pandemic since taking this job in December. This virus is not the common cold. It is much more deadly. It is impacting our society in ways that are very palpable. We still have very high hospitalizations today, despite the declining case numbers. So while things are looking better, we're still not out of the woods yet. The vaccines are working, they're safe, they're effective. Too many pieces of misinformation there to try to correct, but I think you've heard all of them over and over again, that these do decrease hospitalizations, they do decrease deaths, they absolutely are safe and effective. Any treatment, medical treatment, has potential side effects, and there have certainly been some with these as well. But whenever we're weighing a medical treatment with this potential benefit, we have to weigh those risks and benefits. There is a risk in doing nothing, and there's a risk with doing something. And in this case, the risk is much greater with doing nothing and potentially getting the disease. On natural immunity, we're still trying to understand what natural immunity really means. We have studied and measured the response to the vaccine through clinical trials. The response to natural infection is very heterogeneous. There are a lot of different potential responses, from obviously people with asymptomatic infection, many people with asymptomatic infection, to extreme severe infections, hospitalization, and death. So that immune response is so unpredictable. And this is part of the issue with trying to make a prediction on natural immunity versus vaccine immunity, which is very predictable, measured, and studied. And so this is the reason that we strongly support public health's efforts to reach a level of immunity in our community through vaccination efforts that are much safer and much more effective, will not put the strain on our medical system like allowing natural immunity, as we've seen in the last few months, has a huge impact on our local hospitals and our medical system. These are fully approved medications by the FDA. The Pfizer vaccine has been fully approved now. And so we know that they're safe and effective, and can encourage you to consider this as a method to keep your employees safe and keep your workplace open and working, and improve the public health and the public good as well. So, thank you.
Thank you. Director Lee, is there anything you want to add before we move forward into our deliberations?
Thank you, Vice Chair. I would like just to point it out from risk management practice. Over the last 18 months, as a county full of 2,400 employees, it is my belief that we, as a workforce, pursue this challenge of the pandemic with very thoughtful engagement. We instituted several measures, and recently the county's COVID prevention plan, which I asked for a peer review, indicated that our COVID prevention plan is an excellent plan. And we've been following suit with that plan throughout December of 2020 up to current. Certainly, the Delta surge has prevented us, I believe it was just a combination of many factors. But as the data reported to you early this morning, 83 COVID exposure cases that we have been charged in terms of tracking for legislative compliance. Of those 83 cases has been spread throughout since December of 2020 up until the last few days of the month of October. If we are to continue with option one as stated in the staff report, I would like to offer a professional recommendation from risk management. Just because the Cal OSHA temporary standards in place in June does not preclude us from exercising extenuating measures, such as exclusively social distancing, facial covering, branding in a hybrid working environment. Those are the measures that we as a county instituted way before this June 2018 temporary standards. And we have the data to support that while the COVID-19 was all new to all of us last year, we've learned so many things. But from risk management practice, my job here is to support the organizations, and the directions that your board set this afternoon will create what I would call an additional business processes, which I would like to offer. Once a policy is mandated, from risk management and HR perspective, we would require that every single employee is to have the opportunity to share the concerns, whether they're mandatory or if they are seeking exemptions. And those exemptions qualified under medical exemptions or religious exemptions. We would then be working with those individuals to ascertain documentation. And those individuals would be required to do weekly testing based on the current standards. On top of that, that will increase the accommodations, what I call ADA interactive process, because that will engage human resources to have conversations with those individuals so that we can work through and to ensure that they have the due process. Potentially, there's going to be additional worker comp claims, because right now, if a mandatory policy is set in place, and if the employees choose to comply, therefore will be susceptible to the vaccine, should they have any side effects, we would then also be reporting those to worker compensations because that is part of the benefits. And this is now a requirement. Therefore, it is an additional expenditures from worker compensation perspective. Non-compliance will also have to be addressed, as indicated by Director Stevens this morning. While we have the California Department of Public Health orders for the congregates and health workers, those who are in non-compliance, I will be reaching out to those affected departments that we can work through what is an adverse employee actions will look like. The county's merit rule systems does afford the employees the opportunity for due process, and is under the scaling process. It's also under the arbitrations, Rule 10 and 11 of the merit rules. The arbitration process is a very lengthy process. Our current merit rule system requires that the county, as the employer, must appoint one member to represent the panel. The employee has the opportunity to appoint one of his or her chosen members to represent on that panel. Between the two, employer-employee, we need to find a third panelist to serve on the arbitration panels. That process takes time between 3 to 4 months to come to resolutions. And if you're a public peace officers under pole bar, you have an opportunity to go through a series of policies. And oftentimes, if the employees is now bringing in legal representations, the arbitration process can now lengthen up to 2 years. So we need to ensure that we have a policies and a procedure practices in place to facilitate some of this truncated process so that we can move through the numbers of potentially adverse employment actions. On the other end, once we start releasing the employees for non-compliance, we need to start filling back of those vacant positions. So in the last 18 months, we have seen in human resources a very small pool of applicants. The challenges is now how do we add that and expanding those applicants pools to ensure that we can rapidly put HR on demand to fill behind those vacancies. A normal recruitments that we currently have in progress right now takes long time to go through. Again, maybe lack of number of applications, lack of resources, what have you. So that will also add a pressure to the workforce in terms of backfilling. So I offer those perspectives from human resources, from risk management for your considerations, and I'm available for questions and answer. Thank you.
Thank you. hold on. I see there Supervisor Bushnell. So let's see. Alicia, do you have anything from staff perspective before we get to the board members here?
No, I don't have anything to add to the conversation at this point in time. I think I'm pretty interested in hearing where the board as a whole thinks they might be going. And then that's where I would start to jump in.
All right. Well, the first member of the board who has their hand up is Supervisor Bushnell. So the floor is yours.
Thank you, through the vice chair. Director Lee, can you tell me how many open positions we have in the county right now?
Yes, Supervisor, may I have a few moments to get staff, give me that information, I will get back with you.
That's okay. If you just have a rough estimate, I'm just curious.
I would say rough estimates, I would say that we are currently looking at about an open 67 plus recruitment. We do have some backlog of recruitments in place.
Thank you. And then also, is there, through the self-attestation, do we have out of an idea of how many of our employees are already vaccinated that have disclosed that voluntarily?
Yes, the self-attestation was in effect in July. We received a total of 957 forms attesting voluntarily of their full vaccination status. And that's about roughly 37% of the workforce.
Okay, thank you. And then also, since we are back wearing masks and doing the distancing in the county departments, can you disclose how many positives we've had in the last month?
Yes, I would like to read the data. So when the facial covering mandate came back by Dr. Hoffman, I believe was in late August. So in late August, we have a total of 31 cases. Of those 31 cases, we have 20 self-reported vaccinated, being affected with the virus.
Thank you. That's not my question though. My question is, since August till current date, how many positives do we have with county employees that you know that you can report?
Since August, we have 31 cases. In September, we have 6. And in early October, as of yesterday, we have a total of 3.
Thank you very much for your answers. That's all I have for right now, Vice Chair Wilson.
Thank you. All right. Rex, looks like you've got your hand up.
Yeah, I don't know why. I'm after listening to Director Lee and everything else, and if we want to do the process of somebody wants to, we're not going to separate with somebody for 2 years, law enforcement longer. We're going to have the board. We're going to have people. I was kind of leaning towards mandatory with a testing option, but somebody's going to have to convince me not to just stay with status quo and see what the government's going to force upon us and let Humboldt County muddle along, because it sounds like it's going to take yeoman's work to implement this. It has nothing to do with, I always love it when somebody threatens to recall me. Right, that doesn't set well, just future reference. But I just don't see realistically how we could burden HR, and risk management and all the way down the line with all of this extra work when we are being pressed to get what needs to be done as it is. So that's what I heard. Maybe not, but I've been pretty vocal about, I firmly believe in the vaccine. I went on the everybody says, read what the CDC says. And so I went to the front page of the CDC, went to vaccines, and they actually say, get the vaccine. It's the #1 way to get this thing under control. So people told me to go to the CDC. You can't just cherry pick the rights and the wrongs and everything else. And I'm looking at the numbers. There are people that have, the death rates have been dropping. I looked at Israel during the lunch break. I looked at Israel and Iceland, and their death rate numbers are, they're getting people that are getting sick, but their death rates are dropping immensely. So I guess we'll just stay status quo till the big guys force something on us, and that's not too far away. We already have close to 700 employees that fall under the mandatory guidelines anyway, it looks like. So that will keep our hands full for a while.
Thank you, Supervisor Bohn. Supervisor Bass? You're muted.
Sorry. A couple different things, and regarding, listening to what Rick said and, what Linda was saying, and I can understand for the mandated that there is a much longer drawn out process, especially when we're talking someone losing their job, perhaps. Can you go over again why the testing would be so onerous? I'm just trying, I guess before I ask you to answer that, I'm concerned that, I feel badly. I think a lot of our staff, not our staff in our office, but county employees, felt uncomfortable calling in today. I spoke to several separately that, there is an air of interesting stuff in the air that makes it uncomfortable for people sometimes, especially in their work surroundings, talking about their concerns. We have several employees throughout the county who have compromised individuals at their home. So I can understand there are several that did want the full-on vaccine. And I don't think that is really something that would work for us. I can see the mandate in testing, but it's hard when so many other community members, I appreciate people wanting to express their opinions on whether anyone should have to be mandated to get a vaccination or testing. But for me, this conversation right now comes down to our employees, because they are the ones we are charged with protecting. And of course, yes, that means hopefully not having wholesales of number leaving our employ. But at the same time, it's like, how do we do some of each? I think it's, I'm uncomfortable. I get the idea of status quo, but in so many ways, doing nothing almost feels like that's not responsible either. So I'm glad to hear, I want to hear more of the conversation today, but I'm just really wondering what extra onerous, what is added by the testing, Linda or Director Lee, that would be insurmountable if we were not doing just a straight on mandate vaccine. That makes any sense.
Yes.
The cost, I know, is high.
Well, once a policy is set by the board and per ADA and EEOC, the employee must be given an opportunity to express the reason why they cannot be vaccinated. And under the federal and state guidance, we must go through the ADA interactive process. It's a conversations and exchanging and providing and giving the employees the opportunity to provide medical or religious exemptions.
Okay, I guess my question would be different then. It's not that someone's saying, I want an exemption for this and we have to have them prove their exemption. Is there a way we could do something where it's like a mandate, and if you don't want to do it, just go for testing? I get what you're saying about the medical exemption and having to prove it and having to go to all those steps. I'm just wondering, is there something simpler in the middle that perhaps would, be a course that could be a path to be followed? Or does it have to require someone saying, I'm not going to take it because I believe I have a valid exemption, or not?
Well, I think I understand your questions, and it's from HR and risk management, I would have to say it depends. And the reason why I say that, once a policy is in place, it's either you be fully vaccinated or you get quickly testing. So non-compliance is you did not take a test, therefore your livelihood, your job, right? Because you're in subordination. But if you can provide proof or medical or religious exemptions, that is where HR and risk management would need to come in to work with those individual employees to have documentation as to why those individuals are fully exempt. But then there is no middle path, because once a policy is in place, fully vaccinated or testing. So we have to give the employees the options. If they don't want to be vaccinated, they have to go through testing. And from what Director Stevens said this morning, even though 700 congregate employees, there are a handful of them choose to go through weekly testing, but now it's not in compliance. So the issue is, what do we do with those non-compliance? Once the order is in place, it would be viewed as an insubordination, and we have to take action. So,
and if we wait until, if we wait for the state to take action, as Supervisor Bohn says, will we be the ones that still are having to go through those policies and that process?
Yes.
Yes. So we're likely, okay, so it's that same process, and either now or later.
OSHA is pending, looking all of that. And like I said this morning, based on those potentially permanent standards, they will now be part of our way of working in with the employees and the employers throughout the process. So a policy is set, and insubordination is an insubordination. So we do it now or we wait until later. That intersections will be there depending on what path the county would like to take today.
Okay, so either now or later.
Okay, right. So Supervisor Bushnell, and then I have a couple questions. Where did Supervisor Bushnell go?
Thank you. Through the Vice Chair. First of all, I want to thank staff for all the questions they're answering today, and this is not an easy cut and dried subject. The problem for me with that mandate or testing is that with Director Lee saying that 21 people that are vaccinated tested positive, I don't believe that testing just the unvaccinated is a preventative measure, given that vaccinated folks are getting, we had 11 positives that weren't unvaccinated and 21 positives that were vaccinated. So that doesn't make a lot of sense to me. Also, I understand no political statement in it, but people, I don't want to make a choice for someone to get a vaccine and they have an adverse reaction and it's terrible. And I understand people saying that it's one in whatever, how many ever. Well, if that one is your family, is your loved one, I don't want that on my shoulders. I'm sorry. I believe in choice, and I understand the pandemic, but we've had 3 positives in over a month. And how many employees? 2,500, 2,600. I think what we're doing at the county level right now, obviously it's working with only 3 positives. And I will only be voting to stay the status quo. And I do appreciate everybody's input, all the public comment. I have thought of nothing in the last week. It's a very hard decision to make, but I don't have the right to tell people they have to. And I also don't have the right to tell people they have to, or they lose their job that feeds their family. I just don't think, it's just a very hard predicament to be in. So thank you.
Okay, good comments. Okay, I have a couple things, and then I'm going to ask Supervisor Madrone if he's got some questions. I have a question with relationship to the compliance currently. And so if we have some employees that are not complying with the state rules right now, and we have an inability to, what risk does that put us as an organization if we're not enforcing the state guidelines for the employees that are under our charge, that are I assume, administering state programs? I imagine that's probably what why they're under these requirements. So how would that change if then the state expands its requirements to all of our employees? Are we just going to be in the same thing? Like when is our requirement to actually enforce the current employees that are currently required to do the testing that are not doing the testing right now? I'm confused by that. And I think this is a question for either Director Lee or Director Stevens.
I can start, or Director
Sure.
Lee, if you want to.
Well, maybe these are, you brought it up, right? You mentioned that we got these employees that are supposed to, by state requirements, to be tested because they're unvaccinated, and they're not doing it. And so are they insubordinate to this organization or to the state? And how is that going to change if and when all of our employees are under the same situation?
Well, I guess I would first say that the two orders, one from July 26th also includes correctional facilities and detention centers. And so the juvenile hall, the regional facility, and the jail are also included in this. So it's not just DHHS related facilities that fall under the healthcare order. So it's bigger than DHHS. I don't know the number of those employees that are also under that order and what it looks like for them. So I can't speak to that. As county employees, we are required to follow all laws, and the health officer order from the state is included in that. And so we in DHHS have started implementing. We implemented these health orders beginning in early August, or when they, in August. And employees were directed via email. We collected the information of which employees fall under the order depending on what facilities they work in. And they were instructed, they were provided the information on what the order is, and the instructions on what to do with the declination form and what documentation is required for vaccine verification. The order includes several options for how a worker can provide the information for vaccine verification. We've obtained those documents from people, check them off the box. Folks have submitted the declination form. Those that have not submitted a declination form, we are reaching out to them and saying we gave them a deadline of when to do it. And that's where we're at now with needing to work with HR on the employees that are not complying. Either they haven't completed the declination form, which is one part of the order that's required, and the other part is the weekly testing. And so there are employees that are doing weekly testing, and they submit their test results to employee services. And there are some employees that are refusing to test. So that's where we need to work with HR on those particular, what we do in that situation.
Okay. I appreciate that. And we have, I just want to say, we have employee manuals for all sorts of other behaviors that we have, right? I mean, we have an employee manual that says you're going to come to work with clothes on, right? Just saying, like, we have these so-called freedoms or not freedoms in this discussion. We also have in our employee handbooks that we're not going to come to work, in a dirty, or we're required to be clean. We're required not to be sick, right? There's things that are in our employee handbooks that we have these requirements. So this is not the only requirement that we talk about with relationship to the public health and safety of our other employees. So I appreciate that. I also want to say that I too have received and talked to employees that feel kind of unsafe about talking about this stuff, and I realize it kind of moves in both directions, but there are those that feel that they are just not feeling protected under the current circumstance, and they feel really uneasy about coming to work when they don't know the vaccination status of those around them, and working in enclosed spaces. And what we've seen with self-attestation, that many folks that have been unvaccinated in the past didn't do the self-attestation, didn't wear a mask, and vice versa. I mean, and so I think we're not getting a lot of compliance with relationship to that. So that's one of the things that's been in my mind. I mean, none of these are absolutes, right? We're all just trying to like move it in this direction. I guess we're also not in reinventing the wheel here. I think we keep talking about as if this county did a vaccinate and test policy, that somehow we're the first ones or something. That's the part. We have a whole list of other places that have done it. Their HR departments have dealt with it. There are folks talking to people, to one another about it. I'm assuming whatever the fallout from today's decision, whichever we pick, we're gonna follow those institutions that went before us. So, I mean, those are just some of my thoughts on this. And I guess I have another question with relationship to there. We had some folks bring up, and this is for Mr. Hoffman, about people having been exposed already and having natural immunity or not, or whatever, basically testing positive for antibodies that they have from contracting the disease, and the CDC policies on that. I mean, it's not impossible that a board could say, well, we're going to move forward with testing, vaccines and testing. And then if the CDC changes its policy about, or it's what it, with relationship to immunity from exposure, that could change too. So can you speak to that for a second?
Yeah, thank you, Supervisor Wilson. So just one quick point on who oversees the current state health officer orders. So all of those are in areas of healthcare settings that are regulatory settings. So there are regulatory boards that oversee them. I think that was kind of maybe what you were trying to get at. I don't know of any specific actions that those regulatory boards have taken or plan to take, but I know that was part of why those settings were chosen, both because there was regulatory oversight of those settings and because there are areas of a vulnerable population, because there are healthcare settings. As far as CDC definition for immunity, what I can say from what I'm hearing in the news and also in the public health circles is that the CDC is very closely looking at this idea that could we come up with some alternative pathway for people who had natural immunity. And so getting back to my previous comments about the heterogeneous aspects of becoming naturally immune versus the very homogeneous aspects of getting vaccine immunity, I think that's what they're trying to grapple with as a policy level decision. How could we come up with a policy that would match that heterogeneity of natural immunity to a very well-studied, well-established homogeneous immunity from the vaccine? So there were comments made in the public last week that they were potentially coming out with something in the coming month on this from the CDC. But what that policy will look like, I have no idea. I mean, I think, it could be anything from accepting something to flat out saying, no, we're not going to accept anything. It's just fully vaccinated means fully vaccinated with the well-established doses. So
I appreciate that. Supervisor Madrone, do you want to participate? I mean, I know you do.
Yeah, sometimes listening is the best way to participate. There's been a lot to be said today, and I've been listening. And, I think first thing I wanted to say is that it really troubles me the way there were such intense comments with disparaging remarks and threats, as Supervisor Bohn said, being threatened to be recalled. These things don't sit well with anybody. It's really not the way to get your points across. And I think Supervisor Bass also commented on that briefly. I will say that I think it absolutely had an impact on public participation today. And I say that because in the last several weeks, I've received, as all of the board members have, an abundance of phone calls and emails and letters. And when I add all those up and I look at the county employees, of which many of them have sent us communications, the vast majority, approximately 3/4 of those, were in support of vaccine requirements with the testing option. But we didn't see that today. And I have to say, I think that absolutely has to do with the way that people are so intense and so intimidating and threatening and accusations and calling people liars and all kinds of things. I mean, that doesn't do our democracy well, when any of us behave that way. I don't want to see public participation squashed, and I think that's absolutely what happened today. So that's very disappointing, frankly, from my perspective. None of this would be necessary if more people had gotten vaccinated, right? Like we can see around the state of California, numbers have dropped dramatically. The places that have really embraced this have really seen fantastic results in terms of stopping the spread, lowering the numbers of deaths, and all these things. So it's really sad to me that initially it seemed like Humboldt was doing better than the state, but now we're simply not. And that has a lot to do with, what we buy into, what we believe, and what we listen to. And frankly, it doesn't matter what side of the issue you're on, you can find plenty of information out there to support your opinion, one way or the other. But as a scientist myself, I do believe in science. I know it's not perfect. I think about child seats and seatbelts, which have been brought up in the past. Child seats came around and they weren't perfect, but over time we've improved how they were built and how they were installed and where the children should sit in the car to avoid serious injury. This is the same. I mean, nothing's perfect. Nothing guarantees, that it's going to be 100%. But when I look at the data, which I've spent a lot of time doing, it's clear to me that the vaccines do have a very strong positive effect on controlling this virus. I have to say that there's part of me that does have a lot of mistrust about government and pharmaceutical corporations and things like that. And actually, if I spent very much time thinking about pharmaceutical corporations, I frankly would not have gotten the vaccine. But I spent time thinking about it, and I thought, you know what? This is a very different situation. And no matter how I feel about all that, I got the vaccine. And I'm glad I got it. And, my family have all gotten it, at least those ones that are old enough to get it at this point. Last week, I was at a conference in Monterey with a lot of board of supervisors from all over the state. And frankly, I was fairly shocked by the amount of disregard for safety practices, masking, 6-foot distances. I mean, hundreds of people in a banquet room, all within inches or feet of each other, unmasked, drinking lots of alcohol. I'm sorry, but that's not a good, safe way to behave, So, hey, right down the hallway in the hotel, there was a testing center, right? I'm vaccinated. I wasn't feeling any symptoms whatsoever, but I thought, you know what? I'm going to go ahead and get tested again. I've been tested 3 times. I'm not doing it weekly. I don't have symptoms, but we all know that even if you're vaccinated, you can be asymptomatic and carry it around. So I thought, well, for myself, for my family, the responsible thing was to go get a test. It came back negative, 3rd time, and I'm glad for that. But it's not that inconvenient to get tested if it's a priority for us, right? That was really easy. It's a little bit more work here locally, but it still is available and can be done. So, when I think about all these things, choices are really important. I agree. I wish more people thought about women's choices for abortion and other kinds of things. I'm not sure this idea of choice carries over to all these other arenas. That's bothersome to me, frankly, because I do very strongly believe in a person's choice for their own bodies and such. I actually support a mixture of the options. I don't see one there that actually talks about vaccines and testing. They're kind of all separated out into different options. So for me, the option that I support, I'll be very clear about this, and I don't like to call it mandates because I think there's something about the word mandate that's like, we're going to mandate this, manhandle you, whatever. I see vaccine requirements for county employees. And if you don't want to get the vaccine for whatever the reason is, and there's good reasons, religious or medical, for people to not do it, then go ahead and provide that evidence. That's a simple enough thing to do, to go to your clergy, go to your doctor. But so I call it vaccine requirements, but we're not requiring anybody to do it if you don't want to do it, if we have a testing option, right? So if you don't want to do it, then get tested. And if we're going to require this, I recognize that we're going to have to pay for it as a county, and by some estimates, that could be up to $3 million or more. I wish that money was going to be spent on mental health, which is we have such a desperate need for more funding for in our community, or some of the other things like wages for our employees. We keep saying we don't have enough money to raise wages to hold on to our employees, which is absolutely one of the primary factors why we're losing employees over time. It's the wage scales. And so I'd rather see it go to wages, mental health care, roads, and other things. But if we require it, we've got to pay for it, or at least provide it. But that doesn't mean individuals that choose not to get vaccinated can't make a choice to go ahead and weekly test on their own without causing that cost to happen to the county. It's free if you just do it on your own. But if you are going to force the county to step into this void and require it, and then you go ahead and get tested by the county, that's going to cost, right? And I like the comment earlier made by Director Mattson that, in a way, we're giving a benefit to the unvaxxed, paying up to $150 a week potentially for the testing, and maybe we ought to provide that benefit directly to the vaccinated. Well, I think, for the vaccinated, there's much less chance from all the data that's out there that you're going to get it or spread it, but we clearly know that can happen. So I guess my option, again, to be very clear, would be vaccine requirements for county employees with the option to be exempted with the proof. And if you don't want to do that, then a requirement for weekly testing. And I would add to that a recommendation that even vaccinated people get tested. A recommendation, not a requirement, but a recommendation, maybe once a month or so. So those are some of my thoughts on this at this point. Two words keep ringing in my head: protect and serve. Protect and serve. What does that really mean, in the end? And I realize we're short on employees. I don't want to lose a single one of them, because of this. But we all make lots of choices. And frankly, vaccinations in schools, this was brought up earlier, have been around a long time. And about 2 years ago, it became a requirement. If you're going to send your kids to school, you're going to have, I think it's up to 12 vaccinations. And people that choose not to do that can homeschool, right? They can make that choice. That's a difficult thing. I know a lot of people who've made that choice. But again, these are choices that we make in our lives, right? So, it was brought up earlier also that it's probably going to be very soon that this stuff's going to be mandated by the state anyway. And frankly, I think that's why people elect us, is to lead, to be out there and be leaders and recognize we're at that point. We're at that threshold. Let's step up, let's lead and do the right thing here. Nobody's going to require anybody to get a vaccination that doesn't want to. There are options. It's called testing or exemptions with testing. So I just think that's a pretty good set of opportunities there for us all to help protect our community better and to be part of that team. So that's kind of where I'm at, protect and serve. So thank you.
Okay, thank you. So I see Virginia, you've got your hand up there. So
yeah, actually, I'd like to see if I can get Michelle back. Sorry, Michelle. Surprise question. Michelle Stevens, there you are. All right, so I was going back to the earlier conversations and things we've heard about staffing shortages. I mean, we're well aware in our own county we have a lot of that. And you had mentioned, this experience you've had with your folks that are under the state's orders currently. Where'd you go? I lost your picture. There you are. And I guess my thought is, in the past, the state was threatening to exercise control, or if we didn't do what they wanted us to do, they were going to take funding for programs away, which in a sense would also take away positions, it seems like. Have you heard anything from the state that in us trying to figure out what do we do with the folks that haven't been wanting to test, and I mean, it's whether it's yours or this is probably in corrections and other places, are we seeing the state take any efforts into because before it was pretty, they made it pretty clear that, hey, you don't do this, and well, I am sorry, we're going to take that money from you for those programs. So is there any of that talk coming from the state?
As a local health jurisdiction, we had to attest every month that we were following the orders of the state health officer. So it wouldn't be local health jurisdictions that would be hearing that regarding these state health officer orders. It would be coming from the regulatory bodies, like Dr. Hoffman was referring to. So Department of Healthcare Services, for example, is who oversees the behavioral health programs and facilities that we have in DHHS.
I'm just wondering what leverages they're going to try to.
I've not heard anything specifically from us in public health about what that would look like, unless Dr. Hoffman has heard anything, but I don't believe so. And I don't think in my conversations with with Emmy Botzler-Rogers, the behavioral health director, I haven't heard anything from her that she's hearing anything.
I was just thinking as we're talking about positions and programs, I just remembered that previous experience with the state. So thank you for answering from your perspective of what you know. So appreciate it.
okay, Supervisor Bushnell, I can see your hand up there.
Thank you. Through the vice chair, is Dr. Hoffman still on? Where is he? Oh, there you are. Hi, Dr. Hoffman. So the testing, I want to ask some things about the testing. So if we did a testing requirement, so you would test, say, Monday morning when you came to work, would this be something that we would facilitate through the county departments, I'm assuming? So it wouldn't be like a home test and then you come in and bring your stick that says you're negative, or have we thought about those things? And then also testing on Monday, you could be positive on Tuesday. So is that an effective way, really, the testing?
Yeah. Great question, Supervisor Bushnell. So I'll try to take this. Sounds like a couple different questions in there. The first one, just to tackle, is testing a effective method to reduce spread within the workplace. And I think, yes, there's absolutely strong data to support that testing, surveillance testing of the workforce is highly protective of that work environment. It's something that's been used in healthcare settings throughout the entire pandemic. It allows us to identify those folks who are asymptomatic early and get them, isolated away from work, and then do any contact tracing that might be necessary within that workplace to try to prevent spread further from there. Your second part of your question was about what kinds of testing could be allowed. There are tons and tons of options emerging around testing. There are programs that will come to your workplace and test folks, once a week. There are emerging companies who offer home testing. In order for those to qualify, they do need to be proctored. So, you could imagine maybe where a person either at home or at work at their desk and would be in front of a video monitor, just like we are here, and would do the self-swab, and it would be verified by the person and then sent off. So those are available. I don't know about cost for those kinds of programs. I think we will see more and more of those. There are also some companies and organizations that are taking it upon themselves to create their own self-monitoring video technology to implement that as ways to cut the cost of this and to just ensure that it doesn't create more barriers to implementing these kinds of testing programs.
So thank you for that. My thought is, though, if we're doing testing and we're having people come in to the office and you're testing and you're positive, you've now exposed people. So if we're going to do this, right, the point is to not bring COVID into the workplace. But if we're going to be testing in the workplace and you get a positive in that workplace, then what happens? Then that whole area is quarantined for 10 days because they obviously have been there.
Yeah. So, again, we have a lot of experience with this throughout the whole pandemic. Workplace testing has been something that's been going on, throughout. We're now doing it in schools as well. When someone's identified as a positive, we begin that contact tracing. So yes, you're right. Anybody who would have potentially been in contact with that person, defined as close contact, so 6 feet or less for 15 minutes or more, would be defined as a close contact. If that person was fully vaccinated, they would not be required to quarantine. They would be recommended to test at day 3 to 5. But if that person were unvaccinated, they would be required by county quarantine orders to quarantine at home. Whether or not it's done at home or at work, I think because we define that close contact over the 48 hours before a positive test, a lot of times that person would have already exposed those coworkers at work in that 48-hour period. I see your point of what you're trying to get at is it's better for them to test at home, but it's just not always practical to do that. And it's much more practical often to do it in the workplace. So that's what's been done in hospitals, in skilled nursing facilities, long-term care facilities, and that's what we're doing in schools right now with their testing programs. It's just that the most important thing is that we identify someone who's positive and then get them out of the workplace as soon as possible. So if you're testing them frequently, a weekly, every Monday, every Tuesday, whatever frequency works best. Again, these are policy things that you guys would have to design for your program. But if it's that, regular testing, you are again catching those people who are asymptomatic, who wouldn't have been tested otherwise because they, we would hope that all the symptomatic folks would go out and get tested, or if they knew they had an exposure, they would get tested.
Thank you. So my last question is, so if we, or say the government, the state comes down and says we have to mandate texting or vaccination has to be mandated. At what point does it stop? At what point down the road does the testing stop or the mandate stop, or what does that look like?
Yeah. So this is a little more theoretical question here is like, where does this all end? And I'll just say, a lot of us are thinking about that. And I think that the point at which COVID-19 doesn't become a potential burden on our medical systems like it has, so our hospitals and potential to overwhelm the hospitals, that's when, we can loosen up on these things. So let's look at the Bay Area last week came out with criteria to lift their mask mandates in the Bay Area counties. And when you look at all of those, they all point to cases and hospitalizations. And I think really most of us in public health are focused now even more than ever on what are the hospitalizations, because cases we know can be elevated even in highly vaccinated areas. But as I believe it was Supervisor Wilson pointed out, if you have a highly vaccinated group of people, say you're, a San Francisco where you have, over 85% of folks who are fully vaccinated, your hospitalizations are going to be very low. And so the threat to the hospital system is much lower. So I think those are the sort of calculus of coming out of when do we stop isolation and quarantine for COVID-19. That is way down the road. We're talking about vaccines and masking and other policies to control COVID-19. But at some point, we will have to discuss when do we stop quarantining and isolating people who have COVID-19. And I think the short answer is when there's no threat to our hospital system, that if a whole bunch of people got COVID-19, that we wouldn't suddenly fill up the hospital like we did in the months of August and September.
Thank you. And thank you to my board for indulging me. I have one last question, please. So with the testing or vaccine mandate, you just said the idea is to identify asymptomatic people possibly and keep them out of the workforce. I think as we heard from Director Lee, we had 21 people that were positive that were vaccinated. So why would we leave out the unvaccinated people in a testing if that is the idea, is to identify asymptomatic people or people that don't have any symptoms?
Great, these are all great questions, Supervisor Bushnell. And I just want to make sure I understood Director Lee's comment was that those were the people who self-attested to vaccination status. Is that correct, Director Lee?
Yes, that is correct.
Okay, so we had no true verification of their vaccination status. But when we talk about the CDC and the CDPH data that drives all of our policy decision makings, their data really still suggests that if you are a fully vaccinated person who's exposed to COVID-19, that you don't need to, quarantine. There is a recommendation for you to test at day 3 to 5. So those, I would strongly encourage you to implement those as well in your workplace, to recommend testing of those fully vaccinated folks who were exposed in the workplace. That's what we do on a county level when we're doing investigations, and that's what we're doing in the schools. The reason for that is the scientific data that strongly supports that people who are fully vaccinated do have a much lower risk to other people to spread. It's not to say it's zero, but it is much, much lower. And so the overall risk, if you have a highly vaccinated workforce or a highly vaccinated society, like, we were just talking about San Francisco's numbers, the risk to everyone becomes much lower.
I understand, but Rex had COVID. He was vaccinated. So, we can choose or not to, I'm just saying it just doesn't make a lot. I'm just trying to make sense of it, and thank you.
Yeah, no. And so again, I think through the studies, we've seen that if you are fully vaccinated and you get COVID, your chances of passing it on are much lower. And the length of time that you are likely infectious is also much shorter. Again, that, we can talk about, well, should we be isolating people who are COVID positive, who are fully vaccinated? And, we still isolate those people because we still don't have a good strong enough sense of when that COVID positive, fully vaccinated person might not be infectious to someone else. But I think that the point is that the having that immunity really lowers your viral load. It lowers your chances of spreading it to someone else.
I understand that. And my point is, if we're going to test and our objection is to keep our staff safe, then I think we need to test everyone.
So it's not recommended by the CDC or CDPH to do surveillance on fully vaccinated people.
Okay, I'll jump in for a second if I can, take a turn. I want to say that there's a difference. Obviously, this is all about risk reduction, and there's no absolutes. And so I think what Dr. Hoffman is talking about is these aggregated data sets and policies derived from that, which reduce risk, and they're not absolutes, and they aren't created by hypotheticals, the what ifs. What if a person does this and what if a person does that? They're in a larger context, and I think I think that's really what drives so much of our risk policy at the county and in our own lives, and the insurance policies we pay and everything else. It's the sort of hypotheticals about the what ifs, or I knew somebody that, or whatever those are, these kind of anecdotals. If we can, sometimes they can distract us from where the goal that we're trying to get to. And I will say, with the self-attestation at the county, we did find people, I believe there are people who did self-attestation that were not vaccinated because they didn't want to wear a mask, because the choice was at that time, you did the self-attestation, and if you didn't do it, then you have to wear a mask as per the policy. And I believe some people just didn't maybe tell the truth about that. And that actually coincides with what we've seen as polling data that show that unvaccinated people, when a certain percent, I think it was up to 50% in California, and some places in California, would go into indoor places that had signs that said, if you're unvaccinated, you must wear a mask, and they didn't wear a mask. And then that way there was self-attestation that they were vaccinated when they actually weren't. And so we see that happening. And so I think to rely on the data that Director Lee is putting forward in terms of whether they self-attestation and whether or not it's true or not, I think there may be a difference in there, and there may be a sort of a data glitch that's possible.
Mike, thank you for that. Yeah. However, it's not hypothetical that people that are vaccinated are getting COVID, and our intent here is to protect our staff. And I'm asking the question because it's not hypothetical. People that have the vaccine are getting COVID. If we're going to protect our staff, let's protect them all. That's all I'm saying, not hypothetical.
I understand that. And so, and I believe that's true. It's just that we can't be absolutist is what I'm saying. It's like, it's really hard to be absolutist. And if you can't be absolutist, then you do nothing, is kind of what I hear a lot often. It's like, well, the vaccine's not absolutely whatever. And then this is, it's 100%. So I don't want to do anything. And I think that distracts us often on a lot of things. I mean, and using I stop at the stop sign, because I know it's a safe thing to do. I could just go through the stop sign all the time if I want. I may or may not crash, but I'm going to reduce my risk if I stop at the stop sign and reduce the risk to myself and to others. And so, Steve, Supervisor Madrone, and then Alicia, I know you were kind of you had your hand up, and I wanted to make sure Supervisor Madrone, is it okay if I let CEO Hayes jump in here for a minute? Sorry.
Thank you, Chair Wilson. I'm okay. Dr. Hoffman made the comment that I was hoping to slide in there.
Okay, I appreciate that. Okay, Supervisor Madrone.
Yeah, so stopping at the stop sign here, I agree with Supervisor Bushnell that, we all have some responsibility to be testing, whether we're vaccinated or not. And I already spoke to that, so I'm not going to spend any more time on that. So I'm prepared to make a motion, and I believe that this motion actually provides choices for everybody. Clearly, as a vaccinated individual, we already have the choice to get tested. And I will probably try and get tested at least once a month, just, because it's a safe thing to do. But more importantly, if you think you've been exposed, as Dr. Hoffman said, it is really wise to go ahead and get tested, even if you're vaccinated, right? Because the sooner we can catch these things, the more we can stop the spread and start moving away from all these mandates and everything else. So here we go. Let me make an attempt at this and see if we've got any support.
And hold on, before I don't mean to interrupt Supervisor Madrone, but we have in our staff packet these like options that are listed out, and we have a framework that we've all kind of invested in. So I just want to hopefully that you're in the, that it tees off that framework so that we can have the discussion based on that, if that's okay.
Yeah, absolutely. That's what I've done. But as I said in my comments earlier, none of the options actually combine anything. And so, that's what I'm trying to do here is combine options for choices, right? So number one, I would move that we require vaccines for all employees that do not have an exemption, a medical or a religious exemption that is documented. Number two, that we require testing for unvaccinated individuals on a weekly basis. Number three, that we recommend testing for vaccinated individuals if they've been exposed. And number four, we provide 6 weeks for employees to comply with this. So those are all things that are directly out of the 4 options that are listed, but I've combined things together. So that's my motion. Simple, straightforward. I believe it still provides a lot of choices for everybody. If you don't want to get the vaccine, get tested. So that's my motion.
I'll second it. And I had, without a face. I'll second it. I have a question, or maybe it's not necessarily a question, but since we talked about potential recommendations for other employees, I'm curious if it'd be worth, also looking into having the simple tests that we had before. I mean, we had to go through this when we had, when Supervisor Bohn was sick and we all had the little stick, the little test to take. It'd be nice to have a ready supply of those available as well. So in case one of us does feel that something's kind of hinky, don't wait until a month, be able to just take something home. It just seems like having whatever supplies as readily available as we can, whether they're the official weekly testing supplies or just, hey, we want to monitor a situation. I don't know if that's a possibility. It just seems like it'd be nice to have a stash of those available for all departments.
They're available at any of the markets. I went and got a bunch for myself so that I could test. I test often. I don't want to get anybody sick.
Yeah. So, and I think that's a good policy for sure.
Okay. Let's see here. Michelle, do you still have your hand up?
No, I'm sorry.
That's okay. Just trying to manage the scene here. Supervisor Bohn, did you have something you wanted to say in this regard? And then I have some questions, some clarifying questions with relationship to the motion for staff so I can understand it better. Rex, you're muted.
I don't know. I guess you can change the name of a mandate to soften it up, but that's still a mandate. And I look at, you can test if you want to test or whatever. I mean, testing takes 4 minutes. I mean, if you're driving by the Optum site. They were closed yesterday, by the way. But they're 7 to 7, usually 7 days a week, I think is what the times are. I think if we made testing more available, and I don't think it'd be 100, I don't know. And this would be for Dr. Hoffman. How really accurate are the store-bought swab tests? Have there actually been anything done on that? The motion that I would have abridged it a lot more on the part that if you don't want to get vaccinated, you test and leave it just at that. I'm not worried about the people that have been, of all the people that got tested when I got COVID, since I had basically had the shot and the booster. I just got the booster after. Nobody got it. So I think that in itself proves that you don't pass it on, even though I was locked down for 10 days afterwards. How accurate are the tests, Dr. Hoffman? Is there any data? That's what I keep saying, data. Is there any data?
There is data, data and data both. So the data around home tests is that they are quite accurate and reliable. I think that there is some loss of accuracy though, because of the potential for user error or just differences in implementation, right? So when we talk about a program where maybe there's a video self-monitoring system, those have been tested more rigorously to make sure that the person who's doing the test is doing it correctly. And that's the same as if, like a lot of the testing that's going on in the schools right now are self-administered tests, but they're also observed tests. So there's a trained observer working with the student who's doing their own swab to make sure that they do it correctly. And if they don't do it correctly, they can repeat it. Whereas if you don't have that extra step of the self-monitoring or the observation by a trained observer, you might introduce some more error. So the tests themselves are they're nearly exactly the same test as the one that you can buy over the counter. It's the implementation and the processes that have been developed to ensure that it's done correctly and that there are no errors. And I would say, I was going to make a comment to Supervisor Bass's point that those tests are available to your county government and your individual departments within county government through the state. That's a program that's been available since last spring. It does require a little bit of training. It's the program that the schools are using for the most part to test the students. And so I'm happy to talk more about that if there are any questions about the state testing program.
Okay, thanks. So my thing is, I don't know how much training we need to do to put a swab up your nose, but I'm sorry. But I think what I'm looking for is everybody I talk to, because a lot of these people called and says, I don't want a mandate. And I says, I don't want a mandate either, but I want a testing option there because I firmly believe in the vaccine. Now I've got family members that aren't getting it. I've got people on both sides. I haven't lost any friendships. I've had people get mad at me, but I've been on a bandwagon for taking the damn thing because I think it works. And I went 10 days going nuts at home and never got sick. So I believe in it. So with that said, I also believe in everybody's right not wanting to put something into their system that is unnatural to their system. And I hope you're well informed, and I hope it's more than Dr. Google and Dr. Facebook, because there's a lot more to it when you read the accuracies and what's out there and stuff. But what you read is your option. So I would vote for a more abridged version. And as far as testing employees, we're making it sound like Monday morning we're going to test all 2,200 employees that some work on the weekends. I had this vision where we had a van with a couple clinicians in it, or expert nose swabbers, going around and Monday morning they are parked at one place. Monday afternoon they're parked at another place, making it accurate on cost or whatever the case may be. And you have 10 options around, so we can cover a lot of our employee bases, and then they can schedule themselves to go to the nearest place. Now we've broken it up to 10 areas for the, and if there's a position where somebody thinks they've been, I still get tested on a regular basis. It's just to protect anybody else because I can't carry it. But the chances are that it's going to be less of a chance with me because I've got we don't know what the antibodies are. We haven't decided what to do with that. So I would like, that. And so I don't think it's going to cost $3 million. I don't think it's going to cost that much. It's, we're going to have to get a van, clinicians, and the test from the state. And it's going to take the time of the people, but if we have 10 locations that they travel to, pods or whatever, on a regular basis. This is on Tuesday afternoons, they're going to be parked out at the motor pool. Or whatever the case may be, to get, where everybody can congregate, or a larger group can congregate. And then we have that. We added a lot to that, to the motion, I think, to be as simple as possible, because I think the people that are genuinely opposed to the vaccine are genuinely opposed. And if you're genuinely opposed to it, you're not going to get it. And I think our employees, I think we do have a right to protect our employees. And our employees then can go forth and serve the public in the way that we need to. But with that being said, short of mandating, I mean, because it's going to be, we'd like you to get the vaccine or we'd like you to test. And that's probably the easiest way to do it. And I think through public health, they could dial this in a lot easier and find out how to do this. We could maybe have the homeless bus do it at the same time it's going around to treat the homeless. I don't know. I mean, but we know how to travel around and hit certain places. So I don't think we're too far out of the box. I don't know if that's too simple, but thanks.
And I'm just going to jump in for a second. So I just want to get some clarification on the motion, because as I understand it, in that the motion put forward by Supervisor Madrone and seconded by Supervisor Bass has a requirement for vaccination, but having a testing option. Does that kind of define what option 2 is on the in the staff report? Can we just like say that that's what we're talking about? We're really talking in essence about option 2. And is there anything different than that so going back to Supervisor Madrone, just a question. So what you're really saying is option 2 with recommended testing for individuals who are vaccinated, with just a recommendation to those that I don't know how we would message that, would just be sort of like a kind of like a messaging. And would there be an expectation that the county would pay for that, or are we just recommending that they go get the free vaccine or the free testing that's available around? And I guess I'm kind of wondering what your expectation is with relationship to that. And this is a question for Supervisor Madrone, just so we can get some clarification, because I want to make sure that if something passes here out of this, I want to make sure it's where it's clear to staff as to what that is.
Yes, certainly. I appreciate the question. Well, the way I read option 2, it doesn't specifically say that employees would be required to be vaccinated. It's assumed by the way the option is written, but you know what they say about assumptions, right? So I'd rather not make that assumption. And so that's why I thought, and frankly, option 2, I mean, it's like 4 paragraphs, right? So as Supervisor Bohn said, I was really trying to be very, to summarize it and make it really simple. And I can restate it at any time if you'd like, because I've added just a couple of little clarifiers to what I said earlier. Doesn't change anything, but it just clarifies, because I was actually making a couple of assumptions myself as well. And as you brought that up, I looked at that and I thought, let's just be really clear about what we're requiring. And whether or not we call it option 1, 2, 3, 4, doesn't matter. Let's be clear about what we're saying. That's my main point.
Okay, so I think the consensus is we're option 2 includes vaccination with an option to test. And then with relationship to the 6 weeks, is where is that something that you are wanting to, where do you feel, where's that coming from? And maybe I missed it here.
End of option 3.
It came directly out of the staff report that around the state, that's generally what
there it is.
Entities are doing is making it a 4 to 6 week requirement. And I thought, let's just make it 6 weeks. Let's give everybody a chance to get on board. So that's where I came up with the 6 weeks.
Okay, I appreciate that. So that's in option 3 as it is.
Thank you, Supervisor Bohn, for that.
Okay. And then, okay, that's great. I hope that's helpful in the clarification. And then I see Michelle has her hand up. And did you want to clarify something before I go back to other supervisors for more discussion?
I want to ask a question, yeah.
Wrong, Michelle. This was the Director Stevens.
Oh.
I'm sorry.
Sorry to interrupt the conversation. I did want to just make sure that CAO Hayes and Director Lee are, I believe they've done research on the testing, and I don't know how much time would be needed to get something in place that's more permanent. The testing for county employees isn't something that DHHS or public health staff can do. And opt-in is not a long-term option. So I don't know how much time it would take to get some other system, whatever that looks like, in place, whether it's a self-at-home process or another entity that does testing. But I just wanted to point that out, that it's not something that our staff can take on.
And I appreciate that. I just want to, down that line, if the board chooses to move in this direction, would a longer period of time be helpful in this regards, to instead of 6 weeks, 8, 10, or something to that effect? Would that make a difference?
County Council has his hand up.
Oh, I see County Council in his hand up. Don't worry. He's next.
Thank you, Vice Chair. And I think CAO Hayes may want to jump in on this. But I think today is really to get the policy direction on which one you want. And then a fully formed policy will come back, and that'll also allow the time for the meet and confer we need to do with all the labor groups. We wouldn't be formulating all the details today, but you would be giving the direction on what you want. The CEO would look at that and look at all the options and then bring back sort of the developed policy that's been vetted with the employee groups.
That is a very helpful clarification on this. I really appreciate that. And so I'm going to move to Supervisor Bushnell.
Thank you. And thanks for clarifying which Michelle.
Sorry.
I just want to really say that my thoughts are really to protect our staff. And I really think that we need to test our staff in whole. And that's where I really think, given the fact that vaccinated people are getting COVID, I really want to see if we're going to do this and we're going to protect our staff. And that's what I wish also, that we just test our staff. And then with that one statement, my question would be, if we're doing that, if we're testing our staff and we're getting, nobody's coming in that has COVID, what happens with the mask thing? Does it go away? I just really want to express to my board that let's really protect our staff and let's just do the testing. I don't understand the halfway part. I don't. Thank you.
Does anyone on staff want to address that, or? Hold on, Rex. I got.
No, I'm not staff.
Next. So.
Yeah. I just, CDC recommendations are what I would encourage you to follow. And the CDC recommendations continue to be not to test routine surveillance of fully vaccinated people. And that includes in high risk settings like skilled nursing facility or other healthcare facilities where there's a much higher risk.
Thank you. I don't understand it, but thank you, because I don't understand it.
Yeah, the other question about masking, so going back to the Bay Area and looking at what kind of requirements there might be for lifting mask mandates. One county in the Bay Area did implement a more immediate action to lift masking in work environments where people are 100% fully vaccinated only. That was the county of San Francisco. None of the other counties implemented that. And I believe that was because San Francisco's vaccination rates are the highest in the entire Bay Area. There are several of the other counties in the Bay Area that don't have quite as high vaccination rates. So again, because of their high vaccination rates, they're seeing much lower hospitalizations and And the focus really should be on the hospitalizations and, keep making sure we have the capacity to take care of people who, get sick with COVID-19 and require hospitalization. And I mean, we should continue to try to reduce the number of cases total. And that will also, reduce the overall burden. But I think our main, when we do these larger interventions like masking mandates where it's required of everyone rather than a recommendation, or a vaccination requirement rather than a recommendation, it's to protect these larger parts of our society where there are potential for a lot more bad outcomes.
Okay. I'm going to ask that Supervisor Bass, you're next.
I saw Sheriff Hansel's hand up, so I don't know if he had part of the answer that to follow on to.
Sheriff Hansel, are you addressing one of the questions here?
I was the testing of all county employees. I'm testing everyone in the jail facility right now. I'm mandated per OSHA guidelines, per state guidelines to test. It's a congregate facility. And to not create a stigma of those people that, are unvaccinated, all my people are wearing surgical masks. All my people get tested on their first day at work. And it has not created any kind of issue whatsoever with that. And so it is working within our facility. And I know regardless of what CDC recommends or not, it's just a good policy that, everyone get tested, and it's become a routine, and it's not a problem whatsoever for our jail.
Okay, appreciate that, Sheriff Hansel. Jefferson, you got your hand up, so you get to the front of the line.
Thank you, Vice Chair. I just wanted to say from discussions with the policy group, part of this might just be sort of the mechanics of it. I think the best guesstimates are that the county employee vaccine rate is probably slightly higher than the county's general rate. So you're talking about a swing of maybe over 1,000 people. So if your board is interested in that, I think that's something maybe the CEO can look into, how the logistics look between testing all employees versus just those that may be unvaccinated, because it may be quite a change in logistics and what system we use.
Okay. I'm hearing one supervisor asking for that. It's not in the motion currently, but that doesn't mean that's not something might not happen. Supervisor Bohn, I'm going to defer to Supervisor Bass first, since she's had her hand up for a while there.
Thank you. I think a couple of different things I was going to mention. With option 2, it's interesting because it doesn't say required vaccination. It says require weekly testing for unvaccinated staff. So then the question comes to mind, does declaring being exempt have anything to do with that, or would that be kind of a non-issue anymore? Because right now, if we have mandatory vaccination and people have to go through, well, I have an exemption, then that's a different process. But this option 2, where it says require weekly testing for unvaccinated staff, does that therefore take this process of exempting or getting an exemption out of that option? That makes any sense? It does. Okay, thank you. I just wanted to see and I see Alicia nodding her head.
That makes sense.
And then I was going to say, just an interesting, Supervisor Madrone had mentioned being in Monterey, and I see Monterey has instituted a requirement for their staff and their employees, but they did not have a mask requirement until that week we were there. They just reinstituted their mask requirement. I thought that was kind of interesting. So that's why there were so many people running around without masks. It was kind of frightening. So anyway, I just was curious about the exempt, seeing if that was then therefore no longer needed with option 2.
Okay, so I'm going to go back to Supervisor Madrone. So really, it sounds like is it really option 3 that the one that you're kind of focusing on? You're really on option 2. I'm just not clear, because are you saying require? I just want to get clarification, because I want to know what we're doing here in terms of policy. Option 2 is require weekly testing of unvaccinated staff, and option 3 is require staff vaccinations. So can you clarify one more time for me? Because I guess I'm a little dense here.
Nobody's dense. I mean, this is complicated stuff, right? So the clearer and more concise we can be, the better. And I didn't think that any of the options really clearly brought all the pieces together. So that's why I made my motion to be very clear about each piece. And since this discussion has proceeded, I thought I would offer slight clarifications. It doesn't really change things by much, but for instance, the recent question was, if you qualify for an exemption, does that mean you don't need to test? And an exemption doesn't mean you're any safer. You're unvaccinated. So for me, what I would clarify, and I'll read these 4 pieces again and hope it's super clear, and see if the seconder agrees with these minor modifications that really need to be clarified. So number 1, vaccine requirements for all county employees without qualified exemptions. Number 2, weekly testing of unvaccinated and exempt employees. So just to make that clear. Number 3, recommended testing for vaccinated people if they're exposed to recommendation. Number 4, give it 6 weeks. That was the maximum that was listed in the staff report for employees to comply with vaccine and testing requirements. And, frankly, that number 4, I mean, as Jefferson County Council said, staff is going to come back to us here very soon with taking this policy direction and providing us with great detail. And if they come back and say we need 8 to 12 weeks, that's fine. I just used the larger of the dates that was suggested in our staff report. So I hope that those 4 elements are clear. And I'm just wondering, the only changes I made was to make it clear in number 1 that it was county employees we were talking about. And in number 2, that even if you're exempted, you still need to be tested. So those were the only real changes that I made to the original motion. And I would ask if the seconder is okay with those minor but clarifying changes.
I hate to throw a whole kink in the works, but I actually like the simple option 2 by itself at this point. Sorry, I was really, after we went through all this and I had to ask my questions, like, require weekly testing for those who are unvaccinated. To me, that's like, okay, you don't want to get a vaccination, then the testing. I mean, that would be my preference as far as something that is simpler. And so I apologize if your motion stays that way. I'll probably pull back my second, and we can certainly continue the conversation. After listening to all this, I just think that for this step, that would be a good move forward. And then we still have to come up with policy around that. And by that time, who knows what the state law may come up with as well. So
I can appreciate what you're saying, Supervisor Bass. And just to make it really simple, my motion is to adopt option number 2.
Okay, good. Okay, great.
Sorry about that. Thank you.
No apologies, Supervisor Bass. You seconded for the purposes of the conversation. I think that's totally appropriate, which leaves you the option to modify as we move forward. So right now, option 2 is basically what's on the table. I would offer or ask that if we don't either amend this motion and second, that we take a separate vote on option number 4, because I do think that we have there's the kind of the future part of this. There's the employees we currently have, and there's the future of our employees as we move forward. So I want to make sure that that if we don't have this in this motion, we have it as a separate, at least minor discussion, because I think it's important to consider. So we have a motion and a second for option number 2, and I have a couple of hands up, so don't worry, I'm not gonna move that forward until everyone's had a chance to speak. I see Supervisor Madrone still has his hand up, but I'm thinking that probably Supervisor Bushnell is ready to roll. Okay.
Rex was actually next.
Oh, okay.
I can go last. It doesn't matter.
If you press that hand up button, it helps me.
Yeah, I don't know where that is. I've got.
Well, I just want to clarify. My other computer died where I'm looking at my agenda. Can you just read option 2, please? Just the gist of it. I'm sorry.
That's okay. The gist of option 2 is basically the main feel for that is the vaccinations are not required, but if you do not have a vaccination, weekly testing is required. I think that's,
Okay.
do I have that correct? CEO?
That's the gist of it, Leash?
That is correct. Option
Okay.
number 2 does not require any vaccinations, but does require for those who are unvaccinated only to be required to test weekly.
Okay, thank you. I still think we should test everybody if we're gonna protect our staff, but thank you for that.
Okay. And I know Rex, you were without, it's down at the bottom, by the way. You can, that says raise hand. You can press that little button down there.
Just, it says Tom Matson, we're on my bottom. My question is to, I guess, be Director Stevens, because she was pretty adamant that we can't do that testing. And I mean, we do flu shots, we do a lot of things. I was just wondering why we couldn't do that with in-house. I know it's fun to hire, but I mean, we have people, we can hire people, and we can hire vaccinated people. But I'm just saying, if we're going to end up doing just the swabs and everything, why couldn't we provide a, like I said earlier, and have different options for those people that are unvaccinated to make it as quick as and easy and seamless as possible to get tested? Because we, as you well know, we don't have much control if we hire it out, and it says staff is looking without success. And I'm wondering why is that an extreme medical procedure? Or?
No, it's not. We do not have existing staff that could take this on right now.
I agree with that 100%.
I don't know how many people it would take. I mean, we'd have to look at what the numbers look like for how many people have to be tested weekly out of 2,400 people. You'd have to stagger it on different days, because you can't, if it's 1,000 people, I don't know if you can test 1,000 people in one day. So I guess personally, I would say, I feel like this is the county CAO's office, HR, to figure out what testing county employees looks like. We don't currently have staff to do that in DHHS.
So this wouldn't be a public health issue, it'd be a CAO issue?
It's an employer policy. So it's a County of Humboldt employer policy. It's not a DHHS policy.
Huh. Okay.
So let's see here. Supervisor Bass, you're up next, but I do see CAO Hayes there. So do you want her to jump in to answer that question? All right, CAO Hayes.
Thank you. There are really many different models that can be implemented once we have the direction from your board sort of to hone us in on what we're looking for, which is why we're here today. And then with your guidance, we will leave here and formalize exactly what this program looks like. Similar to Supervisor Bohn's comment earlier, my vision is that there is a mobile unit that moves around the county throughout the week on a scheduled basis to test staff at their work locations. Whether that means the general fund through the use of FEMA or ARPA funds pays for recruitment of public health staff and the purchase of a vehicle for them to do that, or if we contract it out, those are options that we'll explore after we gain the direction from your board. But we will work with departments and site locations to determine what that schedule would look like and develop some standard procedures on how we move forward with a weekly testing requirement.
Okay, I appreciate that. So really it's, I mean, in some ways, as we talked way at the beginning of this discussion, it's not unlikely this is the direction that we're going to be seeing coming from above, and we may be just getting ahead of the game, really, in some regards, at least in terms of figuring out how to administer what is likely to happen anyway, and which I think is pretty reasonable policy. So Supervisor Bass.
Yeah, I just, you know, and I did when Michelle was talking, it reminded me, not Bushnell, but Stevens, about we will still have people who don't want to test either. And so, you know, we will still have disciplinary issues that we have to figure out how we do that. I don't think that's for us to have the conversation and make that decision today, because that's not really our place. But I do recognize that we will still have some folks who, for whatever reason, won't get tested. I was curious about those who are taking advantage of the telework policy that we have, and not necessarily having to come in. Would folks working primarily out of the office with telework also be needing to test every week if they're not vaccinated? I was just curious. I mean, it would just take a little coordination when we figure this all out, I think. So Alicia, would that be you?
No, an employee who is 100% remote working would not be required to test weekly because they are, they're not a risk to the organization and the staff per se in that regard. But if they are on a schedule where they come in at any point in time to the workplace, then they would be required.
How many do we have on permanent telework outside?
That is a great question. I don't think we know exactly how many are out. I can only speak from my staff directly, unless Director Lee is on, and she might have that data, but I suspect that she doesn't.
All right, we'll figure it out eventually. We'll know.
Okay, great. So I have a couple more hands up, and then I'd like us to get, move towards a vote at some point here, so we can kind of get on with our day. I think we have done some really good deliberation. There are, I'm sure, some more clarifying points that we can discuss, but CAO Hayes, you're up next. I think your hand.
Right, I just needed to.
Okay, all right. And then Supervisor Madrone. You got to turn on your microphone. Turn on your microphone there, buddy.
Hey, finally I got caught at that. I'm ready to vote, and I appreciate what CAO Hayes said, that, let's provide the direction. Staff will work up with the policy and how it all gets implemented and come back to us. And that makes a lot of sense to me. So I'd very much like to move to a vote.
Okay. Supervisor Bushnell.
Thank you. This is our day, Supervisor Wilson. So I just want to ask a couple other questions, if I could, before we vote. So with the 60 days, Alicia, do you think that's enough time, or do you think that a 90-day would be more appropriate? And also with that question, the reason I'm asking is we have, for the policy, whoever's going to come up with this, we have staff, sheriff's deputies in Garberville, deputies in Willow Creek, and they're on 24/7. They're all the time. We have a resident deputy out in Shelter Cove that comes in once in a while. Are they going to be allowed to do rapid testing? How are we going to figure that out? I know we're going to do that, but I want to know before I vote.
Yeah, the sheriff and I had this conversation that there may be some outliers, and again, that we're seeking direction from your board, and then we'll hone in on those details. Potentially we look into a video self-monitoring system for the outliers, and we provide them with a stock of rapid tests that get them through a number of weeks. We are a rural county with employees who travel to the far reaches. So we have already recognized that there may prove some logistical challenges for a small segment of our staff.
And then can you answer my other question? Do you think 6 weeks is efficient? Do you think 90 days would be better?
I think that 6 weeks from when the policy is brought to your board. So we'll develop it, we'll get the contracts into place if we sub this work out for the employee testing, and then we'll return to your board for final approval after we've also met with the unions. And then from there, we will give the employees a 4 to 6 week window to implement and come into compliance.
So we're probably looking realistically then more like a 90 days, like, yeah, because it's 6 weeks from implement, okay. Thank you. And I'm probably going to really complicate, and I want Tracy to read the motion, please. Number 2. I'm sorry.
I could take a crack at that if Tracy would like. I don't see her.
I don't care who reads
I'll
it.
take a crack at it. The motion would be to implement option number 2, which requires weekly testing for unvaccinated staff, and to return to your board with an official policy after contracting services and conferring with unions.
Okay, that's good. And so as everybody else can, now, just a reminder, when we're done with this vote, wherever it goes, I am asking that we, because I do think option 4 is something we briefly consider. And so I want to make sure if we're ready for that, we should be able to do that. Yes.
Before we get into that option 4, can we make sure we get a report from the sheriff? Because he made the comment that there were a lot of guys wanting to come to work here because we weren't mandating a vaccine. So I don't want to chase off any of these new hires he's going to bring in.
And I want to say that I find that concerning because if we start seeing places that are sort of vaccine, refuges or unvaccinated refuges, that starts to create some interesting dynamics in our, across the sphere of workspaces. And so we can talk about that. I think it's a valid concern, but at the same time,
I just wanted his input on it, please.
Yeah. Okay. So let's go to a vote, roll call vote for the motion on the floor, and then let's speak to option number 4 if we can.
Hi, yes. Supervisor Madrone?
Yes.
Supervisor Bushnell?
Yes.
Supervisor Bohn?
Okay.
Supervisor Bass?
Yes.
And Supervisor Wilson?
Yes.
Thank you. The motion passes 5-0.
Okay, so I'm going to take it back, if I can, to the option number 4, and I have Supervisor Madrone with his hand up.
Thank you, Mr. Vice Chair. Yeah, I think it's redundant and it actually is confusing because what we just did says that all employees would need to be vaccinated, whether they're existing employees or new employees. I mean, no, really?
No.
What? You can bring in a new employee and they don't have to be required to be vaccinated?
Unless we vote on number 4.
I don't get that. That seems very confusing to me because we just passed it for all employees, and if they become an employee, they would be subject to the motion that we just passed.
We didn't pass something that said they have to be vaccinated. We just said if you're not, you have to be tested.
Okay, great. Okay, so, what's clear is that if somebody comes in as a new hire, they either need to be vaccinated or they need to be tested. So maybe number 4 should read that way.
No.
What? I'm
Can you do a straw? Can we do a straw vote, Mike? Just
Sure. So putting all of that aside, this is just a question as to whether or not new hires have a vaccine requirement. I suppose there is an exemption for religious and whatever medical, but putting all what we just discussed aside for new hires, not impacting existing employees, because there is kind of a difference between impact when you're talking about policy and moving forward, like what you have as existing employees and what you have as new hires. And so this is basically that. And so what I'm asking is, thank you for the request, Supervisor Bushnell, for a straw poll with relationship to this, because I think it's not unreasonable expectation that new hires would be vaccinated moving forward. It's being required in a lot of other spaces, required of school students and other things. And so from my perspective, it would make things much simpler moving forward, right? We wouldn't have to have all these discussions about these other things if new hires are this way, and it's a transition into that space. And so from my perspective, I think it's reasonable to have that be a requirement. So that's me. So Supervisor Bass.
Thank you. I generally, when I was reading it earlier, thought it was reasonable. That being said, I think there's some strange dynamics that are underway throughout the state, and if not elsewhere, about what does this really look like. So I would like to hear from the sheriff. I'd almost prefer to have a conversation on this one a few weeks down the road, just because I think there's a lot of pieces in motion, because I think we're making a lot of suppositions on what employees we might get from elsewhere because they don't want to be where they have to vaccinate. And I'm not sure if that's the best recruitment tool I've ever heard in my life. I'm a little bit, but I understand it. So I'd like to hear from the sheriff now. And I'm not so sure if I really feel like I could make my best decision on this one piece tonight, because I think there are a few little different to look at differently. Like I said, I wasn't thinking that last night, but considering the sheriff is concerned, I would like to hear from him. I need coffee. That's what I need.
Get some from Rex's office. All right, so supervisor, any other supervisors? Okay, we're going to move to Sheriff Hansel, but I have to say, I mean, this discussion is now revolving around, it's kind of a smaller segment of our workforce, right? It's an important segment of our workforce, but it's definitely a subset. So Sheriff Hansel.
Thank you. I appreciate the opportunity to speak. You know, it's all up to speculation here. I just let you guys know that there are people that for one reason or another, whether it's a doctor recommendation or the fact that they already had COVID, whatever it may be, you know, they do not want to be vaccinated, and they're required to under their current employers. Now, we have seen, you know, people want to apply for us because of that. I think option 4 here, requiring new employees to be vaccinated, and that's not being consistent with our current employees, will cause issues and will cause problems. And so I honestly don't recommend that. I think it does diminish our pool. And yeah, I understand your point of view. Supervisor Wilson and Supervisor Bass don't know if we want, you know, these quote type of people here, but I think we can't put these people into a box. And they have to pass a background, and a strenuous background. And I don't want someone that's going to be a malcontent, and someone who's going to cause problems. They have to have a superb work history in order for me to hire them. And everything will be taken into consideration. But I just don't want a vaccine mandate for new hires to prevent someone from wanting to come to work for the County of Humboldt.
I appreciate that. And I just want to say, I mean, so much of what's driving this is misinformation, you know, and you know this, and we all know it. I mean, and so when we're having whole pools of our employee base, you know, weeding out based on based on, you know, believing or not believing in misinformation. And in this case, that's concerning to me. And so that is I'm pretty uncomfortable with this. And so I still feel like that this is important, but nonetheless, we'll see how this fetters out today. I don't think it's going to get too far. So Supervisor Bass, you have your hand up first.
Yeah, and I would say, Sheriff, I wasn't talking about those people as in bad. It's just like,
no,
I don't want us to rely on this as a recruitment strategy, whether it's your department or anywhere else. It just seems kind of a little different, and I'm not sure if it's really going to pan out that way, as many people are going to leave their other organizations, and they might. That's why I said I'm not really comfortable voting on this one today to go for the all-out vaccination, because I'd like to do more research myself on what is really going on out there. But also, Sheriff, you know, there are many other times where new hires have different rules that when they come on board, mostly what I'm thinking was sometimes with some of the retirement, and when PERS rates change. I mean, there have been differences at time when people get hired. But like I said, if I had to vote on this today, I'm not going to vote for the vaccination for everyone yet, because I do want to do more research on it. I just wanted, you know, the sheriff to be aware that I'm not totally convinced that it's it's the answer to filling all the vacancies, whether it's in your office or another department. So anyway, that's just my thoughts for the day on it anyway.
All right, and Supervisor Bushnell, you have your hand up.
I do, thank you. And I just want to say, for me personally, I will not vote on a vax mandate for new hires. And I do want to say, Mike, to your or Supervisor Wilson, you know, misinformation or not, for myself, and people have a right to what they put in their body. Fear of COVID and fear of the vaccine is a true thing. It's not whether it's misinformation or not. I think I know, you know, people have a right to what goes into their bodies. And yes, then they can choose not to work for the county, and I understand that. And I understand that argument also, but I will not vote for a max mandate for new hires.
Okay. Supervisor Bass, you're back up again.
Yeah, I just had one, you know, when this may be coming up for conversation, when it comes to vaccination or test, because whoever we hire will need to, we know, if we don't do requirements for vaccination upon hiring, they will still need to be tested or vaccinated. I mean, we just passed that in our other motion. So I guess what I'd wonder is somewhere in the process of the probationary period, hopefully I can understand the vaccination where people don't want to get vaccinated, but I think I would be less inclined to be okay with them not wanting to be tested. So that's a whole nother, is a bigger conversation than, you know, vaccinate or not vaccinate. It's what happens when you do hire them, and are they going to, you know, like I said, I understand the reluctance to vaccine. I don't understand the reluctance to testing. So I'd want to think more on this one specific option.
And I appreciate that. And just one comment before I go to Rex, who has had his hand up, and then the supervisor. I would say that, you know, one of the reasons I think about this is that, or consider it, is because testing is an expense, right? And so if we mandate vaccination so that we hire new hires don't have to test anymore, we're done with that, right? That we don't have to. So we're going to start moving away from testing as time moves forward. That's one of the reasons why we would consider it, because right now we're offering a testing option which has a cost, and we're talking about that cost. It's an administrative cost, it's a fiduciary responsibility that we have, and so it's not without its impacts. And so to try and lessen those impacts, one might consider this, but it's okay. We're having a conversation. Supervisor Bohn.
And I think I've said this for a year and a half, and I do hope Director Stevens and Dr. Hoffman are listening. One of the biggest problems we have is misinformation. So can we attack the misinformation and put more information out there? I know you say you are, but the misinformation's out there. We have a whole team. I don't know how to do it. You have professional people over there that are versed in putting out press releases and everything else. We need to attack some of these things that are coming out. I mean, you know, if you get the vaccine, you're going to grow a third arm or whatever the case may be. I'm getting stuff, and just like I said, I get dozens of things every day saying, you know, that people are dying daily. We had somebody say today that only 1% of all the misfortunes of vaccines are getting reported. So I did the math. I think that's like 1.5 million people are dying after they get their vaccine. I don't think that's happening. So we need to address this, and you guys have the platform. Some of us from the board have been trying to use our platforms, but we're just supervisors, and we just have, you know, our Facebook or whatever the case may be, or if we get a chance to do media. And it sounds like our focus needs to be getting the truth out there. And so these people are making a well-informed decision rather than a Dr. Google, Dr. Facebook decision. And that's just mine, because it was mentioned by everybody today that there's so much misinformation out there, and you guys control the information mission. So it feels, maybe you don't. I didn't.
You want a response? I don't know.
Compete against Mr. Zuckerberg on that one.
We hear you.
No, I think you heard me.
Yeah.
Supervisor Madrone.
Yeah, I don't think 4 is going to go anywhere today. I want to treat all employees equally the same, whether they're a new hire or an existing employee. I mean, I absolutely understand where you're coming from, Supervisor Wilson. And I would love to see everybody that can get vaccinated and stop listening to all the misinformation, as Supervisor Bohn said. But we can't control what people listen to and what they believe, right? That's a pretty big task. So I'm not supportive of option 4. I think that we ought to treat everybody equally, and they should have a choice. If they don't want to get the vaccination, then test. It's that simple. And, yeah, I'll just stop there. I think what do they say about the dead horse? Anyway.
Yep, we're good. Okay, so with that, I think staff has direction. I think we have fully vetted the conversation and the direction. I want to put out appreciation to the staff and to the supervisors and all the public that has given testimony today. There's a lot of passion about these things, and there is a lot of work to be done. I do think that, as I always say, it's like we all have the same goal in mind, which I think was mentioned by one of the commenters, which is that we all want a healthy and happy community. And what we disagree on is the strategy. And that's why we have multiple minds and a democratic process to try and work those things out. So I really appreciate everyone's participation in that. And with that, I will adjourn this meeting for today, and we'll see you all next Tuesday.